Hello, everybody. I've quite the episode for you today. I have back on the show Mr. Yuri Deigin, and I feel it's important to give some background and context for the conversation, and then I have some extra thoughts at the end. I was actually going to go on a bit longer, but this intro was already way too long. I cut that down, but all the same, if you already know what's sort of going on in the context of Yuri's Quillette article, just you feel free to skip forward about 20 minutes or so and just go straight to my conversation with Yuri. And if you don't want to hear me rambling, and which might be advisable, you can skip for that reason as well. Yuri and I talked previously about the lab leak hypothesis and his position on it and support of that lab leak should be taken seriously and there should be consideration and inquiry on it. For some background on what we talked about today, one avenue that really brought Yuri into the spotlight on the issue of lab leak, as well as his publications, was a conversation that he had a little over a year ago, maybe 13 months ago, with Brett Weinstein on his popular podcast, the Dark Horse podcast. As of late, Yuri and Brett have had rather strong disagreements, to put it lightly, on the topic of vaccine safety and ivermectin, where Brett Weinstein is taking the position that ivermectin has great effect in not only treating but preventing COVID-19 illness, and has some concerns about the safety of vaccines, whereas Yuri is the opposite. He thinks there is a lack of evidence with ivermectin and a lack of validity in its application. As well, he has little concerns about the safety of vaccines and has found Brett's positions to be unscientific and to be irresponsible. I guess they had some exchanges about this privately, but now Yuri released a article in the publication Quillette, based out of Australia, outlining his strong opposition to Brett Weinstein and his wife, Dr. Heather Heying, and their positions on ivermectin and vaccines. And he co-wrote the article with the journalist Claire Berlinski. Before I let you dive into the chat, there is a few things I want to say about this whole topic, so bear with me, please. Apologies. One thing I'll note is over the last few months, I haven't known what to take of some of the positions that Dr. Weinstein has taken on ivermectin and the vaccines. I have to note there are some people that are, for their own laziness or convenience, are trying to, completely slime him, brush him away for some of his, political positions or whatever else, have found this convenient. But Brett and his wife, Dr. Heying, have taken the most sober position on so many other issues with COVID from the get-go. There was this charade that was played early on about, we don't know enough about masks and all that. And Brett was very early on to that. And he showed ability to change his mind. When there weren't masks available, he was wearing a bandana for a while, and just his idea under the precautionary principle, hey, something can be better than nothing. We know now, bandanas or, scarves and anything of that sort don't really have much effect. But, he moved on from bandanas, for instance, but was trying to get ahead of this and could see the flaws in the general messaging from public health authorities and the WHO, the CDC, and so on. Him and Dr. Hying were also very early on with the harsh effects of COVID and how nobody should get this disease and don't undermine the severity. And they had lots of concerns about the long-term effects of COVID when early on, and quite for a while after that, it took a long time to fade, how this was viewed was this rigid dichotomy of deaths and recoveries and not enough attention on long-term effects and everything in between. And as you may have heard on this program, if you've listened to some of the other episodes or you've seen elsewhere, like the issue with long COVID is a massive issue now, very severe. And they were ahead of the game on this and very attentive to all the effects from this disease. And even now, they still take it very seriously in its effects and don't take it lightly. I think some other people who are worried about vaccines or are partial to other treatments, a lot have proclivity of not being as worried about the virus itself or hand wave mask use away and those usual suspects. This is not the case for Brett and Heather. Another issue they were early on is just the lack of mask policy was clunky and idiotic and irresponsible. But then when the mask policies were implemented, it was just very simple and also irresponsible. And they were right in pointing out that masks inside are very, very important. Masks outside in a lot of settings, particularly parks and closing off parks, is a complete and utter theatrical frivolity. And there's downwind effects from that. Like, you're going to have all these restrictions that we've had to live through are austere. You don't want to have any, especially after you know that they're not worthwhile, in place still. Because you're just going to tick more people off and you're going to exhaust people off more and more and have more people to be apt over time to care less and less about the restrictions or to dissent with ire against the restrictions as a whole and are going to deflect more people around having some sort of, binding collective uniform action when some of your policies are patently stupid. So as I've talked about on this show before, issues with CDC, WHO, politicians, etc., and specific issues of masks and long COVID, Brett and Heather were really nailing so many issues. And, unlike me, I'm sort of in a circle and in an organization doing it on their own and getting so many of these things right. Now, that being said, that doesn't mean that they're going to get everything right forever. Or what they've said previously makes them somehow more apt to be right in the future. But because of what they had to say on more political matters before, they were on my radar, and I found their COVID analysis for at least the first year to be very sobering and insightful and a great source of information. And so I'm concerned now with what the positions that they've been taking lately, and sort of confused by it as time goes on in the last few months, more and more concerned about what they're saying and what impact that's going to have on the audience who is listening to it, and if there's any validity at all in the vaccine concerns and their ivermectin support, and also, what effect it's going to have on them as a whole, as they were, possibly until very, very recently, a very powerful and strong voice on so many issues. and just generally found it interesting how this has sort of evolved lately. So, with talking with Yuri, I wanted to get his clarification on his perspective on some of these matters, and I found some of it interesting. And I think it serves another function of allowing him to elaborate on some of his thoughts on the article. And when we get into it in the episode, and I'll elaborate my thought on it a bit more, but I found the article very, very limiting or limited, and that there wasn't enough elaboration on certain points where it very much should be. And this whole disagreement between Yuri and Brett has gotten really ugly. Yuri published it, and there's been a lot of harsh words from various parties online. Brett and Heather, you can find it on their Dark Horse podcast. They issued a rebuttal to the Berlinski Deigin Quillette article in a 2-hour episode that was released, I believe, number 87 on the program of their COVID special. And so I wanted to give Yuri a chance to respond to that rebuttal, and as well as elaborate some points on what I think were necessary. So not only are topic of treatments important, vaccines important, and whether you like them or not, and if you have a problem with me defending Brett as I just did on a bunch of issues, and as I do in the talk, as well as being very skeptical of a lot of his claims. If you have a hardline position on Brett and you don't like that, well, that's just too bad. And I have a feeling that even talking about the issue of vaccine safety and ivermectin are so radioactive that me even talking about this issue is going to have some people outright get their panties in a knot, even though the guest I have is strongly opposed to ivermectin, and even more strongly opposed to the concept of the vaccines being unsafe. I shouldn't even say the concept, like the scientific evidence and data that we have on hand is with that opposed to seeing the vaccines as unsafe. Me even just bringing this up, where it should just be all so self-evident, and you just don't talk about it. This is just the way it is. Don't mention it. Don't think about it. And just the little bit of polite, friendly pushback that I do give Yuri on some points to have him elaborate. This can just be, striking to some people. So with all that, this generally ties into what I think is my largest concern for me personally with the pandemic at this point. Before I continue, I'm going to cite a quote. I put it before in something I wrote earlier this year. I don't think I said it in any of these show introductions yet. If I did, I apologize, but it's a powerful quote, and so I'm okay with reappropriating it. It's from Dr. Cornel West from a 1993 debate, and that is, the low quality of public debate in the nation has to do with the degree to which dogmatism and orthodoxy and rigidity and self-righteousness trump conversation and foreclose dialogue. I think that quote perfectly encapsulates my primary concerns at this moment in time. It has been a concern since the beginning of the pandemic, but it's just grown and grown and grown. And I don't have a strong stance one way or the other where we're going forward. I just don't know. Like my previous guest, Dr. Eric Feigelding, he said this is act one of a many-act play. It could be the case. Or maybe we're in the situation that, my premier here in Saskatchewan, Scott Moe, or President Joe Biden seems to be conveying is that, we won screw you, virus. It's all over. So, maybe if it all wraps up, then a lot of these concerns will just sort of wash away. But I'm not really convinced of that one way or the other. And if this does carry on, this issue that is just growing and growing and growing, I think we'll just keep growing more. And that's that people are living in multiple different realities. And there's so much of an interest of appealing to the in-group, being a part of a tribe, seeing somebody opposing you that you just need to get a one-up on them and shut them down. And it becomes this zero-sum conflict and less so of trying to get to the truth. This is a massive issue. And I seen with what was going on with this dispute that we discuss in this conversation is a component of that. I don't think so much so with Yuri, but the publication that published the article, Colette, the editor-in-chief, Claire Lehman, has made her opposition to Brett look like just a vendetta. Now, I've seen Yuri make some good scientific points, and he does so with this talk we have today. I haven't seen Claire really contribute, Claire Lehman that is, contribute anything to this conversation, just acrimony and petty demeanor. Now, I think I just generally agree with her position on the vaccines, but I don't see her contributing anything to this broad, big issue of civil discourse. And that from what I understood at the beginning when her publication started, that was her MO. And so when this article came out and the way that Colette was sort of distributing it and marketing it, it just seemed to be utilized to throw mud. And a lot of their stuff has been longer, and editors will have their hand in whatever. That's just the nature of publications. And I don't know who worked with Yuri and Claire on this one, whether it was Colin Wright, John Kay, Claire Lehman. I don't know. There's somebody else on staff. But it seemed with the polemical nature and what might have been cut out, as Yuri and I discuss, to make it more marketable as a hit piece. That's just what I've found with how Claire Lehman and Brett have been interacting now. It's just a battle and a zero-sum battle. And this isn't helpful. And within some of the groups I've been in, some of the circles I've been running in throughout the pandemic, I've seen the same sort of thing, where it's about appealing to the group, just talking more so in platitudes, and even people bringing in their political presuppositions and their ideology and trying to make that a component of contending with the pandemic when it's irrelevant or even making things worse. Trying to just fabricate the reality that they'd like it to be. And I've seen that happening, early on in the pandemic. People with their own political agendas trying to spin things as they wish it to be. So we need less I'm on team X. We need to revamp our discourse, not keep bringing it down many levels to where it just becomes frivolous bickering. Anyway, I'm going to leave it there for now. This is probably the longest intro of it yet, and I have a lot more to say on that, and I'm going to say that for later. However, I'm going to issue that a little bits over time or something else. We'll see. But I need to give some background on this conversation. I think that's going to make everything that we talk about make a lot more sense, and I think that the last message that I had is an important one. We need to worry much more about the nature of our discourse and sense-making, if you will. If that's not cliche yet. Anyway, enjoy the talk, guys. Thanks for putting up with me. Cheers. Till next time. All right, Yuri. So you wrote an article recently in Quillette with Claire Berlinski. So to start off with that, how did you get working on that article, and how did you get collaborating with Miss Berlinski? And so how did just lay out how that whole project got started?
Sure. And I mean, I kind of feel bad for Claire because, I think some people are calling it the Deigin and Berlinski article, where it actually is a Berlinski and Deigin article. And actually, Claire was the first one to approach Brett and ask him publicly, like, would he respond to her criticism of his dangerous messaging of creating vaccine hesitancy and saying that vaccines are dangerous and that ivermectin is a better, safer alternative for prophylaxis. So once she laid that out and Brett responded to her that, yeah, sure, I'll respond. Claire, basically after I saw that, I reached out to Claire and said that, if you would like, some contribution from me, I would be very happy to provide it, because I already kind of reached out or challenged Brett like back in May, back in June on a lot of those points as well. And I was also very upset that he just continued his misinformation campaign about the dangers of vaccines, and at the same time how safe and effective ivermectin could be as a prophylactic. And so he had Pierre Corey on, which was like, okay. And then he had this podcast that he titled How to Save the World with Steve Kirsch and Robert Malone. And that already was like, what? Like, I really, really didn't enjoy that. And then he went on Joe Rogan with his like emergency podcast with, again, Pierre Corey. And basically, I thought that all of this stuff is very dangerous because it'll just kill people. Like all the people who trust Brett's advice of choosing ivermectin over vaccines that they have available to them in the United States, in America, in Canada, in Europe, and all other places that have vaccines. Instead, Brett and his people he brought on will scare them off of vaccines in favor of ivermectin that Brett claims is essentially 100% effective if used properly in preventing COVID. And those people won't investigate how he got that number. So basically those people, a lot of them will catch COVID and many of them will die. And I couldn't stay silent. That's why I reached out to Claire, and she was kind enough to, welcome the collaboration. So we put out that article, which, as I want to reiterate, that is mostly it's the brainchild of Claire Berlinski. And I don't want to take the credit, but I'll take all the blame and all the abuse for everything that Brett has found or purported to have found wrong with the article, which of course they are gravely mistaken. All of the things that they think are wrong with the article is actually their incompetence and their misunderstanding of what we're saying. And you can have, I go into detail about all of these points on Twitter, where I just have a huge thread on responding point by point of what they gotten wrong. So yeah, basically this is how it came about a few weeks back. So Claire had that tweet. I reached out to her, and then we started writing. I mean, she wrote most of it, and I put in some of my parts or edited some of her parts. Put in some like numbers and things I considered important. And then what we actually did is, I think 2 weeks ago, we reached out to Brett, sent him a draft, because we didn't want to, attack him without, blindside him, basically. We sent him a draft saying, here are our points of criticism. We're willing to hear you out early on. Maybe we, gotten something wrong. If you want to correct something or address something preemptively, we're here. So he didn't respond. Then we sent a follow-up email. He didn't respond. And so we published. And that got his attention. And he gotten him upset, I guess, because he called me a jerk. because of it, although I'm not sure I entirely deserve that. I mean, I don't think the tone of the article is necessarily, it's not. Anyways, doesn't matter. So here we are.
A couple questions that popped in my mind from that. So you sent Brett a draft, and he didn't issue any response to you after that.
Yeah. Claire sent him the draft twice. I was in the CC.
Interesting. And you mentioned before, like Claire was already working on this, and then you got on board. And I heard Brett mention this, that she had got in touch with him before. He has mentioned that, and I can't quote him because I can't remember exactly what he said, but he said something along the lines of, they engaged, and then he felt that the engagement was in bad faith, but he never elaborated on what that specifically entailed. Do you know the nature of the initial correspondence between Claire and Brett?
Well, I'm just assuming that's the Twitter discussion that they had, where Claire reached out and said, "Hey, Brett, I want to point by point deconstruct your argument. Would you be okay with it?" Or I don't even know. Like I don't remember the exact words, but I'm sure if you just Google it on Twitter, you'll see it. And Brett said, "Yeah, I'll respond. Let's do it." And I'm not sure what then he said is like bad faith. And people throw this term around, I think, without actually understanding what the hell it means. And bad faith, from what I understand, or at least like from a legal definition, means some kind of ulterior motive other than the one you're declaring. Or in this case, I guess we're not really trying to deconstruct Brett's arguments. We're not after the truth, but we have, I don't know, someone's paying us to, I don't know, throw dirt, or maybe not paying us, but we just want to throw dirt on Brett, and the arguments we're making are somehow false. Or I don't even know, like, what do you mean bad faith? Like, you think that we're not saying what we think? Are you saying we're saying it because of, it's not that we care about the people that potentially can die from your misinformation, but for some other reason? Or like, you think we're after views or clicks or donations on Patreon that we don't have? Like, what do you think we're after here, other than the motive that we stated, that we want to stop the misinformation that you're producing?
So, I think you were very clear on that earlier. I seen on Twitter that it's this, you don't have any sort of profit agenda, and like even all your work on Lab Leak, you've done the work and you've published some stuff, and it's not any sort of, there's no sort of monetary scheme behind it all or anything of that sort.
Yeah, absolutely. This is all a hobby to me, and this is not in any way connected to even my work. Like, people think, oh, you're like a biotech entrepreneur, so you might be like paid by pharma companies to promote vaccines, and if you're not paid, then maybe you're like hoping that one day you'll have this product that you want to sell to pharma companies, and if you don't promote vaccines now, then they won't buy it like in 10 years, man. And this is like such complete and utter bullshit that is just like hilarious. If you think like this is my motivation, that I'd be like writing stuff about Pfizer and Moderna, or like, it's not even Pfizer and Moderna, vaccines in general, to, I don't know, hope that Pfizer or Moderna buy. I mean, out of the other 3 dozen big pharma companies, I'm focusing on these two to hope that they buy my whatever. Even like, I'm not even sure what exactly they think I'm planning, what therapy. Like, I'm definitely planning to develop a longevity therapy, but I'm sure that like if I succeed in developing a therapy that really extends lifespan, there'll be a lineup of big pharma companies who'd be willing to buy it, regardless of what the hell I ever said or didn't say on vaccine, Lab Leak, or any other topic. I mean, so this is just such a ridiculous argument, trying to find ulterior motive in basically, like, people for some reason, like, there's a recurring theme. Whatever you say, people for some reason don't examine your arguments. They try to examine your motives, like, first and foremost. And okay, even if I do have some ulterior motive, can you just like look at the arguments? Are they sound? Do they make sense? Who cares why I'm writing this? If I'm wrong, tell me where I'm wrong. Give me counter argument. Why are you questioning my motivation without even like me? Unless, of course, you're stupid enough that you can't evaluate the arguments I'm making. In that case, yeah, the only thing you can question is my motive. But like that's on you, dude. You're just dumb. So I mean, I'm not even gonna like respond to you, because if you were smart enough to challenge the arguments, at least challenge the arguments, I definitely respond, because I care about the arguments. I care about being correct, and if I'm wrong, I care about admitting that I'm wrong, and I have absolutely no problem admitting that I'm wrong. And so, but yeah, like questioning the motive is like exactly the opposite of people what should be doing.
Yeah, two things
Anyways,
there.
I feel that like I start. Sorry.
No, go ahead, Yuri.
No. I mean, I start talking, and then I abruptly stop, and I think I catch you off guard. You were like hoping that, or you maybe you're still not prepared to ask the next question, and you're like, oh shit, I have to ask him something.
No.
Sorry.
You go on a bunch and you give me things to think about. But no, 2 points there.
I do.
It is one is that like you sort of mentioned this, you alluded to a theme that comes up often in this discussion with the vaccines and non-patent pharmaceuticals, and there's the idea that there's certainly some sort of collusion going on with the pharmaceutical companies and either the press and or the government bodies or public health authorities. And that could be the case, but there's no reason to like hold on to that with all your life. And I had, that's where one of my concerns are. Well, I'll leave aside Steve Kirsch and Dr. Malone on that. I think they run down a lot of paths that confuse me, but I think that Pierre Corey and Brett have clung on to that concept a little too firmly. It is possible that that's the case, but there's too much of a lean on that without any evidence that I've seen to really substantiate that. But then back to the first point on bad faith, that's an issue I've seen that I've been critical of Brett for doing for years, is that he uses that term a lot, and I think sometimes it is accurate, and that there is somebody making an attack on him with purely bad intentions, so that would apply. And then sometimes perhaps this is the case now that he's also applying it as he outlined with yourself. It's completely inaccurate, but sometimes he'll even throw it out. He'll say somebody's acting in bad faith when they just might be wrong when they're attacking him, and it's a matter of just faith, but he of some sort of orthodox mindset driving it. So I found that Brett has been much too cavalier with distributing that comment or that application of intentions towards people for quite some time now. On the article in general, one criticism as a whole I've come across, and maybe this brings it more so towards your co-author, was that it was too polemical in nature. And you said you contributed some of the scientific attributes, and like I've seen you post a bunch of stuff before this and after this about different papers and so forth, and the scientific angle to the whole affair. But are you concerned that not just with this article, but with the pushback against vaccine hesitancy or just outright anti-vax sentiments, or anything in between, that there's too much of just as I mentioned, just a polemical nature to the argument, and not just cold hard
scientific analysis and rebuttal?
Well, let me just start with saying that all the bad stuff in the article is like totally Claire's fault. So, no, I'm kidding. I'm kidding. I hope like, if Claire listens, I'm sure she like, I know Yuri's just gonna like sell me out on this. No, I'm kidding. Well, I mean, although I said it's written in Claire's voice and it's Claire's article, we definitely worked together on it, and we went through like, I don't know, 10 different revisions, and it actually, like, I don't know if I shouldn't be saying that, but it was like initially a huge article, which we greatly condensed, and like actually Claire then later split it into like 3 different blog posts, and which like on a couple of them, I'm not even in the authorship. And then like the crystallization of that huge piece became the Quillette article, where we definitely worked together, and I definitely like fully support all of the rhetoric devices, polemic devices, anything like so. There's nothing in there that I do not endorse. So I'm not gonna like hide behind anything that I like, even if I would have said something differently, and yeah, like my style is more of like this boring academic, like what, like at least compared to her, I'm much more boring academic. Even though I mean, I like to write it in a way that's readable. Like if you read my Medium articles, you'll see that my style is definitely much less polemic and just in general, because I don't know, I think I just don't possess the necessary capacity to write like that. I mean, I'm just, I'm much more terse and just basically much worse of a writer than Claire is, who comes from like the elite creds tradition of writing for her entire life, of very elegant and beautiful polemic pieces that, sometimes people might take issue with on, I don't know, like on the exact polemic devices used. But I greatly admire the article that we ended up producing, even if, I probably couldn't have written it like that myself. That said, the idea that we should make it, less scientific and more polemic, or more palatable to like a general audience, than like, for example, I would write always like overestimating the degree of scientific literacy required to somehow like understand my arguments. And sometimes people are like, what are you like? I didn't get what you were saying, so I have to. And this is where Brett is great as a communicator. He can really like reach audience, like of lay people. And basically we needed to write it in a way to reach Brett's audience. And that's what we did. And if, in the process, we offended them, that we were not very nice to Brett, or at least like very calling him out style, like I call it jerk style. I'm the jerk, not Claire. Then at least we got him to think. And if they get turned off by the style rather than the arguments, well, it's, I'll live with that. I mean, I tried my best. I'm not trying to be like the savior of everybody, of all the Brett's listeners. I'm just trying to make at least people notice that, Brett might be, or not might be, that Brett is saying wrong and dangerous things. And if you need to be like babied and, I don't know, convinced by very different messaging that Claire and I had, well, I don't know, tough. Like, I can't say I don't care, but I mean, what's done is done. And maybe if this is really the sticking point that we miscalculated, and this is like greatly undermines the effectiveness of our article. Well, oh, sorry. I guess it's like, knowing this and having the hindsight, which is 2020, would we have written it exactly the same way? Oh, probably not, because like most of the people who had a negative reaction to the article had a negative reaction, not to the arguments made, but to the style that they perceived was a little too adversarial. So in retrospect, yeah, probably should have softened it up a bit. But like without knowing this in advance, we didn't anticipate that people would take such issue with the style, because I think it's a decent style for like Quillette and like Cosmopolitan piece trying to call out someone who you think is doing something dangerous. I don't know. I won't try to like really claim that I understand how that style should work. It's really, again, not my area of expertise, like how these literary publications on what style they use. I'm definitely much more on the scientific terse prose side. But basically, to summarize, I think I think I already said. Right? There's no need to repeat what I already said. It's going to be in the podcast. So yeah.
So on that, I guess like what I did see, I don't know how relevant this is, but there were a lot of people who definitely agreed with you already, and just loved it. And then of course there's some people who are opposed to the vaccines, or are in Brett's audience, and they would have had some degree of mindset going in that they're going to be disfavorable to it. So I guess what you're going for is something more in between, somebody who might be engaged with the topic, but is opening to change their mind. And I guess that's also part of the criticism I've seen, is that if you were to make it, and you mentioned before, you need to make it for like a general audience. It can't be just like a scientific paper, because then nobody's going to read it, and except some
that
scientists.
hurts.
Okay, well, not nobody, but you know what I mean.
I definitely know. I'm just
yeah. But I guess the concern there is then, like, if you're looking to, like, you can make it for a general audience, but if you're trying to convert people over or change their mind, like the concern then is that it's a little too scathing in that regard. And I've been worried about this with the conversation with COVID in general, is that people get on sides and then they're just throwing shit at each other over the wall, and then just hoping that the turd lands in the other guy's face. And so I'm wondering what your thoughts are on that, and really the whole COVID situation in general, about how people are getting balkanized and just throwing mud at each other.
Right. Well, I mean, in advance, it's really hard to predict how your article is going to be perceived or even read, and there's a very delicate balance that you need to strike, both in terms of the article generating interest, and if you want it to be heard widely, you need people to then distribute it or retweet it or whatever. And if basically, like you said, if it's too blah, people are not going to be compelled to then even read it, let alone retweet it or promote it or show it to their friends, or tweet at Brett Weinstein, look at what these jerks wrote. And at the same time, if you overdo it, you might get a little counterproductive, that people are not going to listen to your message, but just will be upset with you having that a little bit too adversarial tone. And I mean, writing is hard, man. Like, you can't know these things in advance, and when you're writing things, you have to construct it there's like the there's the message, and then there's the medium, like Marshall McLuhan, and then you have to meld it together and to make it entertaining, and at the same time to make the arguments compelling enough and bulletproof enough. And sometimes I guess we even people like Heather Haying, or Hying, I think is the right pronunciation.
Hying,
yeah, couldn't apparently completely comprehend what we're saying, and make such simple mistakes in reading comprehension that I guess ultimately lands in the problem that we didn't write it clearly enough, or we assumed a bit too much, or we took out too much content that we kind of, again, when you write something, you go through it like a gazillion times through the draft, and sometimes it's already in your head, and you can take something out and forget that, okay, it's not in the paper anymore or something, and it's in your head, so it's for you, it's clear, like what you're saying. It's like, okay, here's A, here's B, here's C, and then when you edit and you take the B out, and here's A, here's C, and of course there's B. It's obvious to anybody who read this paper 10 times like we did, and you forget that it's not there. And then again, reading comprehension issues like with Heather Hying could strike, and they're like, oh, they're conflating prophylaxis and treatment. And like, no, we're not. It says here, there's prophylaxis and there's treatment. And this is the quote that says, in the study that, looked at the symptom resolution, which obviously is treatment. How can you make the mistake that it's not treatment? Anyways, so yeah, basically I just discussed this on the other podcast. So it's still fresh in my mind. And I'm sure you have that question as well somewhere down the line of what exactly did Heather Hying mean when she said you don't know what prophylaxis means?
I do have that question.
My crystal ball is correct.
Yeah. You have the gift of foresight. But yeah, we can move on from the construction of the article itself, because I'm assuming your guys' concerns about editing it down is just so that you garner more attention than people actually read through it, because Quillette doesn't have very specific length boundaries from what I've noticed, and they'll publish things quite a bit longer than that. But at the same time, maybe you want to have it a certain length, just so that you make sure people get through the whole thing, and it's a lot more succinct and all that. And
they have their own editors, so it's not just us. I mean, there's editors, and
right.
They took a knife to it, and we had back and forth with the editors, and
okay.
Some parts they took out, and then they're wait, no, that's important, you can't take that out. This, the magic of modern publishing. The editors also, they'll take your article and turn it into something you barely recognize. But not in this case. But sometimes it can happen.
Yeah, the battle with the copy editor. But I guess we can jump. Like you mentioned, the point that Heather made with the prophylaxis and all that, and I went over the actually, before we go into the specific points, you obviously listened to the rebuttal that Brett and Heather had on their program, and I went over it. I'm sure you were.
Where the thread I had on all the points that I responded to, or you went over the actual podcast?
Oh, both. Yeah, no, I watched it. I seen your thread as well, but I guess give a general sense of the impression that you got from the rebuttal that they gave.
Mm-hmm. Yeah, I mean, if you read the thread, you already know my general sense that I'm very happy to have them put that out in a podcast, because there is incontrovertible evidence of just how incompetent Brett and Heather are. And it's just laid bare for all to see that they are very incompetent on questions of drug development, pharmacokinetics, data analysis, or just basic biology at times. That it's great that they had that podcast. So, and I mean, I do go point by point to highlight what exactly I mean that they're incompetent. And, if you're interested, it's all on Twitter, it's in the thread, or, I mean, we can just discuss it now point by point if you have precise questions about like where exactly they demonstrated the incompetence.
Sure. Well,
but yeah, like basically the overall impression is that first of all, yeah, they betrayed their incompetence, and second, they didn't clear any points of criticism. Like they didn't have any good arguments for all of our arguments.
None.
So they're still wrong. They still haven't proven anything of their initial claims about ivermectin supreme effectiveness as a prophylactic. They didn't prove anything about vaccine being dangerous. They just reiterated that in a 2-second piece. Brad's like, oh yeah, the spike is still toxic and the vaccine doesn't stay at the injection site. Like, oh, not this again. But yeah, they didn't provide any arguments. And I mean, they claim they still will publish something, and maybe in there they'll provide. And other than they blindly trusting the Carvalho study that, showed 100% effectiveness, again, they didn't provide anything why they think it might work. All of you hear about, but Yuri Deigin doesn't know how it works, but it might work this, and we don't know how it works, but it might work like this, or it might work like that. Like, this is not scientific argument, dude. Like, give me a good reason to believe you. So far, you're not. And whenever he tries to give any good reasons, it's laughably incompetent. Like his telomere theory or telomere hypothesis that, the drugs that have been approved by the FDA are still dangerous because their toxicity has not yet been adequately assessed because they were tested in lab mice, which Brett Weinstein in 2002 has shown have much longer telomeres than wild-type mice. And for that, they must have much better tolerance of toxicity. Like, this is laughably wrong. Like, really laughably wrong. And so, yeah,
that's a big point that Brett has that he's talked about quite a bit. That's one of the
he's so proud of points. His, telomere discovery. So Nobel Prize. Like, what?
Yeah,
this is like Dunning-Kruger peak of Mount Everest, This is just ridiculous that someone can anyways.
Yeah, well, I'm curious about that point. Like, I'm not a scientist. I don't understand this. So I understand the point that he's trying to make, but I'm not in any position to be favorable to it, nor to really scrutinize it. So I'm curious about that because Brett and Eric Weinstein, Brett's older brother, have been very favorable and adamant about this. So what is the issue with the telomere hypothesis?
Right. Well, I mean, Brett thinks that he's discovered that lab-bred mice have elongated telomeres because of breeding protocols or the issue with breeding protocols. And so back in 2002, when he was a grad student, apparently he discovered that lab mice have longer telomeres than wild-type mice. And that in itself, as a discovery, is questionable because there's just so many different strains of mice, and telomeres are just so variable between different individuals, between different animals, that you would need a very big sample size of all the different strains of mice. I mean, for each strain of mice where you want to measure the average telomere length, you need a lot of animals to do so, and of different ages, because telomeres, actually negatively correlate with age as well. And so if you're actually comparing distinct ages between distinct strains, you might see results that are not representative of the strains, but are more representative of the aging dynamics of telomeres. And but mice are, animals with some of the longest telomeres. Mice, rats, although squirrels have actually longer telomeres, 50,000 kilobases. Squirrels, mice actually vary between 30 to 50,000. Some lab mice were shown to be even 150,000 K long telomeres. But all of this is maybe a curious observation. But to make the leap that this observation is somehow biologically relevant, especially biologically relevant to tolerance of toxicity, is complete and utter conjecture, which like completely unproven and just plain wrong. Because toxicity, small molecule toxicity, or even I mean, like there's different other insults that you could do. You could like radioactive insult. You can like, but this doesn't matter. Let's stick to like the point of Brett's claims that small molecule toxicity or just drug toxicity that's been assessed in mice is somehow underestimated because the mice with longer telomeres, he thinks, are better able to tolerate toxicity or recover from toxicity, like sublethal toxicity, which again, like who cares? Where are we? Like toxicity is assessed as a lethal dose. Like are the mice dying or not? It's not like assessed. How quickly do they recover? But even like the idea that somehow telomere length is responsible for the tolerance of toxicity is wrong. I'll try to be moderately polite. We're on a Canadian podcast, right? So we have to be nice.
That's right.
Right.
Hey.
So, and again, yeah, like telomere length, and there's been this telomere hypothesis of aging, basically, that maybe it's the telomeres, like the Hayflick limit. Yeah, it's been popular, I don't know, 10 years ago. The Hayflick discovered that actually, contrary to what Correll, I'm blanking on the name, on the first name. Basically, there was this dude, famous, I think it was Nobel Prize winner, that said that in vitro cells can divide basically forever. Cells are immortal in vitro. But then there was this Leonard Hayflick, who actually discovered that no, actually after a bunch of divisions, cells just stop dividing. And so he discovered telomere, or the Hayflick limit, and then discovered telomeres, and then they discovered telomerase. I guess it was Elizabeth Blackburn, or like I used to know all this stuff. I was like very deep into telomeres. Basically, the Hayflick limit is that after 50 divisions, cells stop dividing, and the hypothesis was, or I guess a theory that's been proven, that that's because of telomeres. Like once telomeres get too short, cells don't divide anymore, and they just go into senescence. And so if you actually induce telomerase in those cells, they can keep dividing, or you can immortalize cells that way. Cancer cells have telomerase constituency active, like it's always active. It elongates telomeres. That's why cancer cells are immortal, can divide, as long as possible. And the idea was, okay, maybe this is tied to aging somehow. Maybe we're aging because our telomeres get too short and just our cells can't divide anymore. Which even on a logical level is actually a pretty silly hypothesis, because like what tissues do you think are limiting our survival? Is it the brain tissues, which don't divide after birth? Is it some like neurons don't divide? Is it muscle tissues? Is it our like blood cells or hematopoietic cells that just keep dividing all the time and have telomerase active? So telomeres are definitely not a factor, a limiting factor in those tissues, in fast dividing tissues, in blood cells. So basically, the telomerase or the telomere hypothesis of aging has been disproven for a long time. And although it didn't stop some proponents of not even like there's been the telomere theory of aging, and there's like telomerase hypothesis of life extension, and they claim telomerase has many other positive functions in the body other than just elongating telomeres. And if you upregulate telomerase, you can actually extend lifespan. And there's been like a Spanish group in like Maria Blasco in Spain that has shown that if you like transgenic mice, or even if you do a gene therapy in wild type mice, inject them with telomerase gene, that somehow extends lifespan by like 20%, which for mice is not really a lot. But still, it inspired people like Liz Parrish to try telomerase therapy on herself. And there's Bill Andrews, who is one of the premier names in like the telomerase life extension movement, and there's Michael Fossel with his Telocyte company who wanted to do a trial in Alzheimer's for telomerase gene therapy. And actually, they're doing 2 trials now in Alzheimer's patients in Colombia and in Mexico with the telomerase gene therapy. One of them is from Liz Parrish from BioViva, and the other company is actually affiliated with Bill Andrews. But it doesn't matter. Like, I get on tangents basically.
We went over that last time.
Yes, I'm sorry. I mean, telomeres is something that I've been really deep into, and let's climb back out of this deep well that we gotten into telomeres. And coming back to Brett's claim that somehow mice with long telomeres would be less susceptible to toxic insult. It's by itself, it's bullshit. And then the second order bullshit is that somehow can mean that drugs have been inadequately tested before being allowed in humans. And this is second order bullshit, because mice, first of all, are not the only animals in which we test toxicity. You're required to have animal trials in at least 2 different species. And usually it's more than that. It's mice, rats, dogs, sometimes non-human primates. And that's just to start human trials. And we only are allowed to start phase 1 trials, which phase 1 are designed to test safety. They're usually in healthy volunteers, unless it's for cancer or something where you can't, ethically do it in human volunteers. But most of the drugs, especially small molecule drugs, are tested first in phase 1 in completely healthy people to just assess their safety, assess that there's no toxicity. And they only will do so, they only start testing after it's been demonstrated in many animal species that they're safe, the drug is safe. So, and then they're tested in humans, of course. And only then we'll start testing efficacy in humans after we have confirmed that the drug is safe in humans. So for Brett to be very suspicious of pills because he thinks mice with long telomeres will somehow inadequately confirm safety of drugs is just so juvenile, incompetent that I don't even hearing that drops the level of credibility of anybody from close to zero, basically. If a biologist says something like that, or biologist says something like this, or a drug developer or a pharmacologist says something like this, the level of credibility drops to zero. So whatever he says afterwards, you take it with a huge grain of salt, and for good measure, because he then proceeds to say a lot of other silly things. And again, if you have
and here we are.
Particular questions that you want to address, we can address those.
Just one. Yeah,
that was a long telomere.
I was wondering. I've never heard
detour.
A counter argument to that. I heard his discussion about that, I think on his own accord a bit, and then he had a big talk with Rogan a little over a year ago, and then
Rogan is the premier expert on telomeres, right?
Well,
but basically, I think he just has never been challenged on it, because people don't challenge other people, even if it's a false belief, just because it's just not nice. It's not hurting anybody. Let him think that he made this grand discovery, and why do you want to ruin his self-image by pointing out that discovery is bullshit? But now, if it's actually relevant to the discussion, if it's relevant to his credibility and to his competence, it demonstrates his incompetence on questions of life and death, where he is trying to promote ivermectin, and he's been so wrong on pharmacology before, then I think you have to point that out, and that's what I'm doing.
So one point he would bring up on the telomere hypothesis, and I'm not sure if there's anything really to parse from it, but tell me what you think. I found it interesting, but maybe it's irrelevant. Is that he noted that what was it, his graduate super? No, I can't remember. Somebody else who was working with, she dismissed his claims in a way just of not so being inaccurate, but of lacking importance. But then he noted that she took a lot of his work and utilized it for herself. If some of that work was then utilized, do you recall in what way that was utilized and what relevance and what relevancy would have there?
No, I actually haven't heard that argument made, but I mean, again, it's irrelevant because that hypothesis, first of all, yes, it sounds okay. It could have a grain of truth that lab mice could have longer telomeres than wild type mice if they are bred somehow for, I don't know, like do they? It's possible to breed, like you can have artificial selection on any characteristic that you want, but it's just irrelevant. It's certainly irrelevant to drug safety, and it's irrelevant to pretty much any other assessment of anything in lab mice other than telomere length. So I can't even think of a study that would depend critically on the assessment of telomere length that isn't, because again, relying on telomeres as some kind of biological explanation for any phenomenon has been proven wrong and wrong again, and like from longevity to, I don't know, but basically, it's irrelevant. So even if he did find that lab mice have longer telomeres, whatever he then concluded based on that is still wrong, because telomere length is irrelevant to like the rest of the biology of mice or other mammals.
Got it. Okay, that was interesting. I've wanted to hear more discussion on that topic, but I guess
here first.
There we go. I guess we'll jump back to what Brett and Heather earlier this week issued towards you, and so we can go back to what you brought up. And so Heather said that when you were criticizing the prophylaxis of ivermectin, that she said you cited a study on treatment, and you were mentioning you started mentioning about how that's not accurate. So go for it.
Yeah, sure. So basically, so we had this paragraph that was on, actually I have it, actually I can pull it up in the article and I'll just read it. And yes, so Heather said that we don't know the difference between prophylaxis and treatment because in the paragraph on prophylaxis, we reference a study on treatment to support our claim that we have, I guess, no evidence or something, or no evidence of ivermectin's prophylactic efficacy, which, as I pointed out in a tweet on this, is just Heather's inability to comprehend what she's reading. So let me, I pulled it up. I'll just read the paragraph. So the previous paragraph talked about the vaccines, like how great they are, the mRNA vaccines, how what a huge percent effectiveness of efficacy they have. And so the previous paragraph is like, reports the Pfizer mRNA vaccine is 93% effective in preventing serious illness and hospitalization for the Delta variant. If you're looking for a miracle drug to protect you from COVID-19, look no further. This is it. This is it, being vaccines. So in the next paragraph, the one that Heather Hine took offense to, the next paragraph, how does the evidence for the prophylactic efficacy of ivermectin stack up against the vaccines? It's not even close. Next sentence. Remember, we don't yet know that the drug provides any significant benefit. Any is italicized. Any means any being neither prophylactic nor treatment. Next sentence. A high-quality study published in JAMA found that in a randomized clinical trial that included 476 patients with mild COVID-19, a 5-day course of ivermectin compared with placebo did not significantly improve the time to resolution of symptoms. So, like, if anybody thinks that this sentence means anything about prophylaxis, where we say patients with mild COVID-19 compared with placebo did not significantly improve the time to resolution of symptoms, anybody with like 2 brain cells who knows anything about drug development, if those two brain cells know about drug development, they'll obviously realize that this sentence is talking about treatment. This is a study we're citing, which we say was in patients with COVID-19 that did not improve the resolution of symptoms. Obviously, this is what we're citing in support that the drug does not have any proven benefit, any being neither prophylactic, which we'll get to in the next paragraph, or treatment. So, like, it's this the sentence, how a person with adequate reading comprehension, the paragraph, how with adequate reading comprehension would be reading is, how does the evidence for the prophylactic efficacy of ivermectin stack up against the vaccines? It's not even close, period. Remember, we don't yet know that the drug provides any significant benefit. A high-quality study, blah, 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 no difference between placebo or ivermectin in treatment. Next paragraph. But again, for the sake of argument, let's go with the most generous interpretation of available experimental results. And then we go back to prophylaxis. This site, which purports to offer a highly dubious real-time meta-analysis of ivermectin studies, claims the drug's aggregated prophylactic efficacy is 85%. Even if this were true, this would mean your odds of developing COVID-19 while taking ivermectin are about 6.67 times lower than those of a counterpart in the control group. But if you've received an mRNA vaccine, however, your odds are 20 times lower. So basically, 3 times better protection vaccines offer than ivermectin, even if we take the most generous meta-study estimate of ivermectin's prophylactic effectiveness. So, like anybody, I think, with decent reading comprehension reading this will understand when we're talking about prophylaxis, when we're talking about treatment, we're saying that the drug does not have any proven benefit when studies are done properly, basically. The JAMA study is an example of a randomized placebo-controlled study conducted in good institution that we trust, and we show that when done properly, it does not provide any benefit over placebo. Here in treatment, but even if we trust the studies about prophylaxis with aggregated 85% efficacy, that efficacy is still like 3 times worse than that of vaccines. So we're bringing it back that advocating for using ivermectin over vaccines is suicide, because ivermectin is, even by the best estimate, 3 times worse. So 3 times worse means, 3 times more people will be killed by ivermectin if they choose it over vaccines. That's it.
So
I don't know.
You think that Heather really misread you there then?
Well, I don't know. Either maybe she did it in bad faith. Maybe she wanted to paint me as incompetent and decided to use this mildly unclear way in which the paragraph is structured, that it's prophylaxis, any treatment, and then we prophylaxis, then any benefit, no significant benefit either, and then we we show that in treatment it doesn't have results, and then we go back to prophylaxis, and then she's like, oh, this demonstrates, or whether it's in bad faith or in good faith, she thought that we're confused, and basically she's the one confused. And I think this is a more really, I don't think she did it in bad faith. I think she's just incompetent, even at basic reading comprehension.
So I'll try to play devil's advocate on a couple points on that one. I guess.
Go for it.
Well, I guess
Lucifer.
Yes, 'tis I from the depths of hell. So, actually, more so on one point, and then just more of a general question for the second. So, I guess is it important then to bring up at all perspective degrees to how much the vaccines are better than ivermectin when we just don't know? Should you maybe just leave it then at that level of abstraction that we just don't know?
We just don't know how good ivermectin is? Yeah,
that it has any effect, or to what degree the effect is, than to just going off of prospective effects and just leaving it at just that level. Is that we don't know?
We're not going off of treatment effects. We're going off of prophylactic effects from other studies. 85% number of ivermectin's prophylactic efficacy comes from prophylactic studies of ivermectin, aggregated. There's like been dozens of them, which exactly why we don't trust the Carvalho study, because Carvalho study is the only one that claims 0% infected in the ivermectin group versus all the other studies that have, comparable rates, at least to between the two groups. And like if you aggregate all the other like dozens of prophylactic studies of ivermectin, which ivermectin proponents think prove that it's efficacious at prophylaxis, that number of how efficacious it is, 85%, is still way worse than vaccines, which have been proven to be 95% or even higher effective in like randomized, huge sample size, very trustworthy data. So we know like 95% is like absolutely certain, at least 95%, versus 85%. Like this is probably wishful thinking. These are very underpowered studies. A lot of them are not even randomized, not even double blind. So and ultimately we'll have the proper study, I'm sure, of ivermectin's prophylactic efficacy, which will show it to be near zero. Like this is my belief. I'm willing to put it out there. But as of right now, even all of the proponents think it's at least or at most 95% effective. And that's just much worse than vaccines. If this is what you're going by, you're still making a grave mistake, because you're giving yourself 3 times worse protection that vaccines could provide. And vaccines provided like once and for all, whereas ivermectin, you have to take it, I don't know, weekly at least, if not bi-weekly or maybe even daily. And who knows what its safety profile is for like long-term chronic administration. Nobody actually did it. Nobody knows. Nobody took it for months or years on end on a weekly basis. And like this is a whole other issue. But even all those issues aside, vaccines just are way, way superior in the the most important metric, protection. At least 3 times more effective by like the most generous metric of ivermectin. So this is what we're writing. And again, if it wasn't clear, I guess we didn't do a good enough job.
No, maybe I just got something jumbled in the moment. So you're saying that there is a lot more concrete evidence on the prophylactic effect, but it's a lot more up in the air on the treatment effect.
No.
Oh, okay.
No, basically what we're saying is when studies are done properly in like a double-blind, placebo-controlled way with a big enough sample size that it's well enough statistically powered, like the JAMA study was, that the efficacy of ivermectin is shown to be almost non-existent. And this was a treatment study, so we don't have the same study for prophylaxis. There is no study to which we can point and say, okay, like prophylactically, they did a proper study and they didn't find anything. For prophylaxis, we use the best, like the highest bound for ivermectin effectiveness, like based on all of the prophylactic studies, most of which were badly conducted, just not very trustworthy. But we'll give ivermectin the benefit of the doubt and say, even if it was working as well as you guys are claiming it's working, based on your meta-analysis of dozens of small studies with potential bias, that number is still way below vaccine efficacy, and vaccine efficacy has been proven.
Yes, so very much so on the efficacy point, indeed.
Yeah, so these are the 2 points we're trying to make. That even though the most important point is that we don't know it has any efficacy because it hasn't been proven in a conclusive study, and the studies that have been done properly haven't shown efficacy. But again, absence of evidence is not evidence of absence. Just because we haven't yet had a good study, a good prophylactic study done properly that can rule it out. Okay, let's just for a second assume that the claimed 85% is what we'll see if we do it properly. still 85% sucks compared to 95% of vaccines sucks. So even if you trust ivermectin's, studies, still picking it over vaccines is stupid.
So that brings me to another question, I guess, that can sort of generally cover the disagreement then between you and Brett and Heather. Is I think you've stated that their studies are cherry picked or something along that lines and are inadequate. And it's, you outlined in the article, you touched on the Argentinian study and I believe some others, and then their general point is that your studies are inadequate. So just I guess for somebody as dumb as myself, listening to both sides, let's sort of go over like the what your perspective is of the difference between the studies that you've been utilizing and the studies that Brett and Heather, as well as Dr. Corey, have been utilizing.
Sure. Well, I can try. Basically, it's not what we're cherry picking. It's that we're showing that when studies are done properly, and I mean, drug developers have known this for decades, that when you badly constructed studies can give you great results, but when you do the studies properly, those great results disappear because those great results most likely came from bias or just other things that you didn't control for. And that's why you do randomized, double-blind, placebo-controlled, to avoid all the kinds of bias that can give you good results. And so when studies done properly, like we had the JAMA study, or there's a few other studies that have been done in a proper way, ivermectin is not shown to be effective. So it's only shown to be effective with a big degree of efficacy in treatment or prophylaxis in bad studies. That aside, there's just one study, the Argentinian study by Hector Carvalho and others, that Brett is using as justification for why ivermectin is so great as a prophylactic, because in that study, ivermectin has shown 100% efficacy. Nobody gets sick in the treatment group. And they had two stages. Basically, overall, they had I think 788. No, overall, they had up to 900 people in the ivermectin group between the two trials, and 0 got sick, while at the same time in the control group, in one hospital, 92% got sick. 92%, there's a huge disparity. And basically it's to any person with any expertise in at least even statistics, not even drug development, to know that there's such huge disparity between groups. It's a huge red flag that there's something about those data that's just not trustworthy. But Brett is using just that study, Brett and Heather, I guess, to justify that ivermectin is something 100% effective when used properly. And he never actually qualifies what does it mean when used properly. I've asked him that at least a couple of times on Twitter. He never responded, but he makes that claim twice on his Save the World podcast. And I guess a lot of people just listening to him take it just on faith that ivermectin can be 100% effective and we can end the pandemic if everybody took it for a month. And the only data point that Brett is basing that is this Argentinian Carvalho study. That's the only data point that can support the argument for ivermectin's 100% effectiveness. Whereas two dozen other studies of ivermectin as prophylactic don't have anywhere near 100%. The 80%, 70%, 82%, somewhere in the 90s, but aggregated meta-analysis percentage of prophylaxis is 85%. Why, though, Brett chooses to believe this huge outlier with huge methodological problems, over the other body of evidence of ivermectin being at most 85% effective is beyond me. And this is like our biggest argument, or our biggest question, I guess, in the Collette article, in my communication with Brett. And he never actually justifies why he chooses to believe that study, other than like he just like he attacks me like, oh, Yuri Deigin thinks it's fake. Oh, isn't that libel? They can sue Yuri Deigin. Like, oh, he thinks they're lying, huh? He thinks they're lying. Like, this is your justification? Like, why do you trust it, man? Like, look at the data. Look at the study. It's fucking laughable, okay? You trust that shit? I mean, if you do, that just shows your incompetence. But like, don't tell people not to take vaccine over your incompetence, that you trust this one study out of Argentina, because just there's no reason to trust that study over anything else, even out of the other dozens of not very good studies as well. So this is my main problem with Brett's misinformation.
Two things there, I guess. To be fair, and maybe this is too much of a stretch, I don't think he's ever said for people not to take the vaccines. But then, of course, to counter that, that there's so much discussion within the last few podcasts that he's done that are concerned about their safety. That
no, well, I mean,
maybe I'm being pedantic on that point.
He pretty much says this that, oh, I'm not vaccinated, but I'm on prophylactic ivermectin, which is essentially 100% effective when taken properly, which, is not telling people don't take vaccine or, use ivermectin instead, but effectively, this is what he's doing. And
right.
Like all the fear mongering on vaccines, how they're like exploding your ovaries and the spike protein is toxic and it doesn't stay in the injection site. All of that shit is creating the vaccine hesitancy that is supposed to like lead you off of vaccines towards this wonderfully safe and wonderfully efficacious ivermectin that Brett thinks is 100% effective.
Actually, that brings me to something I was going to ask you earlier. That wasn't discussed in the article, and also I wasn't really too much involved in this discussion, but Brett did mention it in the rebuttal again, and it's been brought up a few times. They keep making the claim that the spike protein is toxic, and I haven't really heard that claim much else, and a lot of people are really concerned about that claim. So do you want to go over that one? Where there's some inaccuracies?
Yeah, sure. I mean, actually, I think that claim has kind of faded from fashion of the anti-vaxxers. As I mean, there's been a number of things that have kind of been fading in and out of fashion for all the like fear-mongering anti-vax rhetoric. Like initially, people were like concerned about ADE, like antibody-dependent enhancement, that like, oh, you get vaccinated and those antibodies will actually like help the virus get into your cells or get into your macrophages, and they'll be like persist there forever and ever. And this has been proven to be, false. There's
never heard that one.
Oh yeah. Oh well, I'll get you up to speed on the latest vaccine.
Thanks, Yuri.
Bullshit. Maybe I shouldn't. And people are like, oh shit, I haven't heard that one before. What do you mean antibody dependent enhancement? Oh, wait till I get to the prion stuff. Oh, the prion stuff is like, what's the next thing? Like that spike protein is somehow like or prion, I guess most people call it in English prion disease, with those prion proteins, like in mad cow disease, that because the spike protein has this prion-like domain, that it must be also the prion-like protein that can like just start this chain reaction of protein misfolding, and it gets into your brain, and you'll have like this basically essentially the mad cow disease thing where you'll just succumb to basically you'll die. That was popular, I guess, I don't know, 3-4 months back, and then again it just faded because like it was complete bullshit. And then the spike is toxic thing. So yeah, that was again like people were just trying to do experiments. They like, what exactly is so bad about COVID that, you know, it causes so much pathology, and like the cytokine storm, the immune reaction is definitely the number one thing that is really killing people. But they were also thinking, okay, maybe the spike, like there's something in the virus itself that's so bad. And they like, how about the spike protein? Maybe the spike protein alone, like if it, I don't know, breaks off of the virus and then travels around and can like bind to some things, and maybe it can mess things up on itself. And if that's the case, then vaccines are like the worst thing you can have, because vaccines will just create lone spike proteins in your cells, which can then, you know, exit the cells or break off of cells, because they're supposed to be expressed on the cell membrane actually for the immune system to notice them better. But some parts of like sometimes actually the spike gets cleaved, and these spike pieces actually get into the blood and travel around the body, which is actually a very small concentration. It has been shown that the lone spikes do persist in the blood of vaccinated patients, but for like a few days and a minuscule concentration of like picogram per milliliter, and they actually much lower concentration, or like lower, not much, but lower concentration than what COVID patients actually have. So it's not a vaccine thing exclusively. It also the same thing happens in patients who have COVID. They also have the circulating spike protein, like lone spike protein proteins, but again, in small concentration, and it gets cleared, and it doesn't really present any long-term pathology. So there was a study out of Salk, out of the lab of Yuri Manor, this Israeli guy, which cool guy. We actually interacted on Twitter, who has assessed like what happens with just the spike. What can just the spike do? So what he did is he took lentivirus and pseudotyped it with the spike protein. Basically, it's a foreign virus that the binding, the receptor that it uses, they replace it with the SARS-CoV-2 spike. So, and it's an inactivated virus, so it doesn't replicate inside cells. It's basically a research tool to see what the hell happens when this spike binds to different cells. And they noticed that, yeah, it binds, like it can create some kind of problems with, because it binds to the ACE2 receptor, it can create some kind of problems with cells or the mechanisms that rely on the ACE2 receptor. If you like use very high concentration of the pseudotyped viruses, virions, then yeah, you can mess up the signaling, the angiotensin renin signaling, the ACE2 receptor. And the cells in which it enters, if it enters in large concentrations, that they can die. Again, but okay, like this is what happens with SARS-CoV-2. The virus enters, but it's not a lone spike really, because in that study, it's still a virus. It's a lentivirus with the SARS-CoV-2 spike, chimera. But in any case, so they did show that, yes, spike in itself could have problems in large concentrations, but that study out of Salk used the concentration, which is like 40,000 times greater than anything seen in actual patients. And I mean, it wasn't like, even that wasn't complete and utter terrible effects. So they actually concluded that study by Yuri Manor that yeah, it's not good, but at least it's not it's not that bad to not vaccinate. Basically, even in concentrations 40,000 times greater than what's seen in vaccinated people, it's not like awful. But all the vaccine skeptics kind of seized on that study, jumped on it, and like, oh, see, this says that spike protein alone is toxic, so we can't vaccinate people because all these lone spike proteins will just bind to the ACE2 receptor and wreak havoc, and people are just going to be, because of the vaccine, they'll have huge problems. Which, of course, there's been such thing as clinical trials conducted. Nobody had huge problems based on these vaccines. So just because you misread the study out of the Salk University does not use your two brain cells to realize that maybe you have something wrong, rather than it's the researchers with decades of experience developing new drugs have mistakenly let 40,000 people test the vaccine and didn't notice how toxic the spike is from that vaccine. So that was one thing. There was another study
Okay.
also assessing. Now it's actually the protein. They use the protein, the spike protein alone, the molecule, not a pseudotype virus, but the actual molecule. And they injected it in mice, not injected, but like through they put it in the lungs, like intratracheally, I guess the English word is. So, and what they noticed is those mice develop an immune response. Surprise, surprise. You inject, and the dosage, by the way, in those mice was like 100,000 to 1,000,000 times greater than the dosage seen, the concentration seen in human patients with vaccinated spikes. And those mice didn't die. Their lungs didn't explode. They had an immune reaction and they lost weight compared to the control group. But in 2 days, they regained the weight and they, went on to recover essentially from that huge insult with the huge amount of spikes. So in a nutshell, no, the spike protein itself is not toxic in the doses that you would ever see it after vaccine. So, and that just because seeing Brett repeat that shit is like so disappointing and misinforming. Like now this could be in bad faith because it has been shown in a number of times that this is not true. Why do you keep repeating that? Sorry.
Well, if the mice lost a whole lot of weight from that, I think I got to get myself some of that high-end spike protein, and it'll help me out a bit.
There are better ways to lose weight, I think.
Spinach.
Yeah, you could just get COVID. At least it's a lower dose. People lose weight. Kidding. I'm kidding.
I'll pass on that one. Yeah. Not the best idea, but I think Brett got to the spike protein being toxic point from Robert Malone, if I'm not mistaken. Maybe that's incorrect, but so is that likely where Malone got to that conclusion? And what are your thoughts on him in general, if you have much from what you viewed on beyond from what you viewed on Brett's conversation with Malone as well as Steve Kirsch? Because and I've been talking about this a bit with people lately, because they had the podcast, and Mr. Kirsch gave me an anxiety attack, I think, just for listening to him. But Malone seemed calm and sober, and I wasn't sure what to make of it at the beginning. I've been kind of unsure what to make about a lot of the content since Brett had Gert Vandenbosch on the show, but Malone. The first thing that I thought was odd was Malone's claim of being the mRNA the inventor of the mRNA vaccine, and I thought, well, that's substantial. And I didn't look ever into the history of mRNA technology and who invented what, and I've been mostly focusing on just having discussions with people and more of the political aspect of the shit show that has been the pandemic the past year and a half. But just from sort of grazing over the general information that I first came across on mRNA and mRNA vaccines, I didn't find anything on Dr. Malone. I also seen that this seemed to be like an endeavor that's sort of gone on since the 60s. That seemed to be the hypothesis phase in the 60s. I may be having some of this incorrect, and if anybody wants to hold me to that, I really don't care. I'm just giving you the general sense. It seemed to be like in the hypothesis stage in the 60s, and there was some development in the 80s, and then it's just sort of gone on from there. And that he claimed that he was the sole inventor. And then I sort of looked into his publications, and these are all papers that I'm not going to get a whole lot out of from reading, but a lot of them did look significant in this field that he was a co-author on. But at the same time, like that, it just seems like a leap. So, is this likely the source where Brett got these ideas from? And what do you make of Dr. Malone in general,
right?
And on the stuff that I just brought up there?
Sure. Well, just to the first point, I don't know if this is like the source, if it was Dr. Malone that gave the spike is toxic. Like it could have been like Tess Lawrie, or it could have been actually Gert Vandenbosch. I mean, this idea that, you know, vaccines are the devil and there's just so many bad things about them that we
I don't think it would be
realize.
Van den Bosch. I think I don't. Maybe I'm wrong there too. Maybe he did bring up. I think his concern, which I don't understand, and also can't make sense of, and sounds odd, and I haven't really heard anybody else say, but it's mostly on like the mutations where he's concerned. I don't think he's brought up anything about the toxicity.
Well, yeah, mutations and his pet project are like these natural antibodies, these IgM antibodies that somehow are much better than anything that vaccines could generate. But yeah, like doesn't matter where he got it from. It's bullshit. So whoever, the originator of the bullshit doesn't really matter. Now, in terms of Robert Malone, he did come across as a very kind of nice guy, very measured guy, like intellectually deep, at least like maybe on the background of Steve Kirsch, he did seem that way, or even Brett Weinstein. But I didn't investigate too deeply like his claims to like being. I don't know if I don't think he claims he's the inventor of mRNA vaccine, like definitely not the COVID vaccine, like I think he claims he's the inventor of mRNA vaccine technology.
That's right.
Which, you know, I mean, again, like what does it mean, the inventor of technology? The idea is, yeah, you're right. It's, I don't know, it's like 60s or at least like the 70s. I mean, it's pretty obvious idea of, why don't we just deliver mRNA into the cells to do what the hell we want? I mean, it could be for vaccines, it could be for gene therapy, it could be for, I don't know, other reasons. So, like, you can deliver DNA, you can deliver RNA. DNA is a bit of an issue because you need a vector. And mRNA was an issue because we didn't have the technology to make sure it doesn't degrade and to make sure that, like, lipid nanoparticles were really the enabler of mRNA delivery technology. And I don't know, like a lot of people were working on this, and whoever wants to claim credit, who's the first, who's not the first, to me, I mean, I don't really care. And like from just tangentially from I heard, there were other people also working on this, and there's this, like, if you go on Wikipedia, who's actually accredited as the inventor of mRNA technology. There are a couple other people. I don't know, was it Hungarian? It doesn't matter. But basically, Robert Malone's name is definitely not among the first to pop up. And I think this is actually like what's driving a lot of his pretty much behavior. I think he's been kind of hurt by not being recognized, and he's been spending his past, I don't know, however many years trying to correct for that, and just goes around and tries to make sure that people hear it from him that he is the inventor of mRNA technology. And that's what like his website is all about, and all of his publications on it. Basically, there's just one core message that Dr. Malone is trying to promote, and that message is Dr. Malone is the inventor of mRNA technology. And so maybe everything else is just kind of the way to accomplish that, or to get him, publicity, to get himself heard. Maybe that's the reason why he goes onto those podcasts and says those things. But the things he says are pretty questionable. Let's be generous here. So and I mean, I challenged him on Twitter on a couple of points, and I mean, he's definitely not as bad as Steve Kirsch, who is I don't want to throw enough insults for the past week, but yeah, Steve. I
think we can leave Steve Kirsch off to the side for this general conversation.
Yeah, let's do that. But So basically, I don't know. Do you want anything else on the topic of Robert Malone or
No, I was just wanting to get your general sense. I just have been trying to figure out like what's going on with him in general, and it's an interesting mystery. So I just wanted.
actually, good point that I almost forgot to bring up, because
Okay.
I think he kind of claims that he has some kind of like big pedigree in drug development, and he's like knows all these FDA people, and this kind of makes you think that he's very qualified in drug development. But then he says things that are so completely inadequate, like the vaccine wasn't tested in animals before being tested in humans. Robert Malone says this, and I'm like, what? Like, this is not something a person with drug development experience should be claiming, because it's like so ultimately not true. And even like in the same podcast, Steve Kirsch produces the graph of rat ovaries, where he claims, oh, the lipid nanoparticles peak in rat ovaries, that, like, should give you pause. If rat ovaries, animals, you just said vaccines weren't tested in animals, like, anything going on, like any alarm bells in your head? No? Okay, maybe. So yeah, like, definitely I'm not sold on Robert Malone's competence in drug development, and whatever research he might have done in the 80s on mRNA technology is one thing, but like, I don't know if he's qualified to assess the safety or efficacy of vaccines or ivermectin, to be honest. So I guess
fair
with
enough.
that we can
We'll see how this mystery then unvolves over the coming months, or maybe doesn't.
Sure.
So another one that Brett and Heather were taking issue with is that there was the testicular dysfunction study on rats, and they took issue with that. And I'll note as well, and correct me if I'm sort of misreading you guys, but later on you note that adverse effects or lack thereof in animals do not necessarily translate to the same effect in humans.
Yeah, of course. Yeah, but I mean, this is not the main point, neither of ours, nor of Heather's. I mean, she said it in passing, like, but I noticed it because it was like, which is in rats. Rats are not humans. And I'm like, wait, but this is the argument you make about rat ovaries being a huge, safety issue. Why are you so dismissive of rat testicles? Like, what's the discrimination here? Male rats are humans too. Anyway, but yeah, the main point she makes is that somehow she, like, that study that we cite, I don't think she read past the abstract, and the abstract is like saying that the biggest effect was observed in combination of ivermectin and verapamil or whatever. I forget the second drug name. But obviously there was also an effect of ivermectin alone. So if she actually would have read the study and looked at the tables, and I posted the tables, I highlighted the differences. In just that study, it's clear there is a negative effect on rat testicles of ivermectin. And it's not the only study. I mean, there's many other studies that have shown a negative effect on male reproductive toxicity of ivermectin. And I've in that thread and on Twitter, I also provided a couple other studies. So if she even bothered to look into this topic, she wouldn't be embarrassing herself claiming that somehow we did not show, and it actually shows the opposite. No, it doesn't show the opposite. Like, read the damn paper, Heather, or go on Google and actually like do some research. I mean, we're not pulling it out of thin air that ivermectin has testicular toxicity. We're using like FDA guidelines that we're going off of and providing primary references for what those guidelines are based off of. So yeah, that was ridiculous.
Okay. I think I have just one more from sort of relaying what Brett and Heather had to say, and just let you issue responses. And then I got a couple questions of my own just from reading through. Or actually, maybe I have two more. Just one note that Heather made, or Brett and Heather, on they took issue with you mentioning the point where you guys said, "Does this pass the smell test?" And Heather quoted Richard Dawkins that failure of imagination is not an argument.
Yeah, well, basically, this is all they're going by, their imagination. That's their foundation on which they're basing the ivermectin effectiveness. Ivermectin's 100% efficacy of preventing COVID. Their imagination. It's purely, that's the only thing that it's based on. And yeah, failure of imagination, I guess, is not blah blah blah. But imagination is not something we use in science to make life and death decisions. So anyways, but yeah, they're not providing any explanation why the hell they choose to trust that Carvalho study with its purely imaginable 100% efficacy, which does not pass the smell test, at least for me. No, I don't trust it for a millisecond. Am I claiming fraud? No, I'm not claiming deliberate misrepresentation of data, like the actual authors knowingly put this fake numbers out, knowing that they're fake. I don't know whether they've been confused, misled by other researchers, by patients not reporting positive tests. I don't know what the hell happened, but I know those data are false. And I'm not sure why, Brad's like this is one argument they're making that, and it's so funny. Yeah, I mean, I pointed it out in a tweet that I don't trust this study for a second. And because Brett and Pierre Corey did an episode on it, and they're like, well, unless the numbers are fooling us, 100%, like ivermectin is 100% effective, unless the numbers are fooling us. And I'm like, yeah, Brett, the numbers are fooling you. This study is, very badly conducted. It's not randomized. It's not double blind. It's not placebo controlled. And he thought in the podcast that what I'm pointing at is not reporting bias, but some sort of a placebo effect, which again is like, for someone not to understand what I mean by the comment that the study is not randomized and not double blind, to think that I'm implying that it's the placebo effect that is able to explain the 100% effectiveness of ivermectin, rather than reporting bias, basically fake or false data. This is like beyond, this is just demonstrating the sheer incompetence again of Brett and Heather, who just, why would you invent, again, or overabundance of imagination? Like, they can't fathom that the study could be false, that they have to invent reasons why it must be true. And yeah, like placebo effect, what? Anyway, so yeah, it's a travesty.
And then the last one, they took issue with, remind me specifically now, I think it was in regard to questioning the effectiveness of ivermectin, but you cited an Alberta Health Services report. And on one hand,
on Canada.
Yeah, on one hand, I'll admit I didn't get a whole lot out of Brett and Heather's additional substantiation as to the significance of that. They just seemed a bit scorn about it. Maybe I missed something in their argument, but they just seemed to hand wave it away. But I did have a look through the report, and maybe this isn't the best argument on my part, but I did see it was approved and revised by Dr. John Conley, who was recently in a debate with Dr. Kimberly Prather of UC San Diego and Dr. David Fissman from University of Toronto. And he made a lot of absolutely ridiculous claims about the lack of effectiveness of masks, and the perils of masks, and the dismissal of airborne transmission and all of that. Maybe that's just indicting a person involved in the report instead of having to look at the whole report. But that's one thing that popped into my mind. And I also didn't really understand Brett and Heather's overall concern. They just sort of said, Alberta Health Services, who are they? But
they're just Canada haters. You know that. That's all they do.
Well, we're simple folk out west here. But just get your thoughts on the report and Brett and Heather's concern with the report.
Yeah, I don't know like what they're concerned. I didn't know the author or what his other claims are. It just
it wasn't even one of the authors. He like, to be fair, he's one the people approving and revising it. A single author, and I can't remember who that person was.
So yeah, I don't see any methodological issues with that report, and it's just one of the several meta-analysis that have been done, and just skeptical, and it's just, I think, completely warranted skepticism of ivermectin effectiveness, just because it hasn't yet been proven to a high enough standard. And this is essentially what the report is pointing out, and I don't think that's news to anybody. So I don't know what their problem with it was, to be honest, I don't really care. I mean, it's such a minor issue to.
But you remember that
cite a bad report, like, okay, well, you cite a better one, but basically you don't. Still, it's not about like which reports you rely on, which meta-analysis you rely on. You just rely on this one Carvalho study with 100% efficacy to claim that ivermectin is something 100% effective. This is like, and you tell me that the Alberta Health Services meta-analysis is bad, while you actually trust the Carvalho study. Like, these are such huge disparity in like double standard that it's not even funny.
Yeah, fair enough. And I think Brett and Heather should have elaborated further on their point on that. I wasn't understanding what they were getting at, and they said they're going to write something in response to you guys at some point. So we'll see what happens there, I guess.
Yeah, I'm still waiting for them to write or explain why they trust this Carvalho study over anything else. So
yeah, I'll move on from relaying what they had to say. And if anybody else is interested, it's the most recent episode of the Dark Horse podcast, and you can watch that and take take what you will from that, and the rebuttal of Yuri and Claire Berlinski. So then, from me reading through it, you guys brought up the YouTube terms of service, and that a couple of the episodes were promptly brought down, and maybe I misread it a bit, and because you guys just stated it, like you didn't really lean on it too much, but I'm not really a huge fan of the YouTube terms of service, and really under these terms of service, my show should be flagged on a couple points, like non-pharmaceutical intervention, because it leans on the WHO, and a lot of stuff discussed on here has gone against the WHO. They haven't had adequate policies on masks, and they've been leaning too heavily on social distancing and all that. Not that social distancing is bad, it's a good idea, but that masks are where the big point of focus should be. So there's a lot of things that I've said, or that guests have said, that are completely contradicting the WHO. So I'm not sure that the YouTube terms of service is really the best thing to bring up, or maybe I just misread you, and it's just it's something that you guys are sort of stating in passing, that this is what this occurred at this point, and then Brett's stuff got taken down.
I'll tell you a secret. We actually had a huge, bigger section in there that I think it got moved into, I think, the first or the second Substack posts by Claire. So like on the freedom of speech, and where does that end? If where does your freedom of speech should it end anywhere, and where it actually can lead to killing people if they trust your arguments. Should you still get the right of free speech, and what is the right of free speech on a private platform which has terms of service that you agree to, and essentially they can be as arbitrary as possible, I mean, as they want, and like complaining about it is, if you don't like it, find a new platform. So, I mean, but those are really issues I'm much less interested in than maybe even Claire, because I'm not an influencer. I don't blog. I mean, I don't have a YouTube channel and whatever to me. And I mean, I'm not a fan of censorship by any stretch of the imagination. And again, I'm probably not supporting what YouTube has done by removing Brett's videos, because I think actually it had like the Streisand effect, that more people actually, downloaded it from other platforms or viewed it that would have otherwise, if Brett didn't claim that he's being censored and like the government is suppressing good information about like this magical drug. And yeah, I'm just not, like, in general, I'm just not a fan of censorship, because I know it can very quickly disintegrate into, today you support censorship and then it actually censored something that you think, shouldn't be censored. And growing up in the Soviet Union, I know all too well that, censorship is a very slippery slope. And now even with like Trump and social media, like I mean, as much as I don't want to say hate Trump. I'm not a fan of Trump. I don't want to say I hate him, but I'm definitely not his fan. But seeing him censored on Twitter and like Facebook, that to me was very reminiscent of like Soviet Union.
Yeah, I'm definitely not a Trump fan either. And I was very concerned about the whole Trump Twitter ban. That just this company is taking down the most significant international head of state and head of government. I think a lot more people should have been concerned about that, rather than, oh, I hate that dumb-haired asshole and he's taken off and hooray. Very, very, very short-sighted.
Yeah, absolutely. So I think that there's definitely a bigger debate that should be had about censorship, and but I think it's a bit tangential to like this situation. I mean, not that it. I mean, it's just, I think right now we should focus on like the medical stuff and to make sure we get it right, and then we can have the debate about like, oh, is Brett's monetization like taken away fairly or not fairly, or if it, in terms of service on a private platform, does that, is it censorship, or is that like, freedom to conduct business, and all the, I mean, there's definitely like a debate to be had, but like, I think now is not the time. The time right now is let's figure out the actual truth about, what's safe, what's effective, vaccines versus ivermectin, and get that message corrected. And then we can, once the pandemic is in the rearview mirror, we can then have all these debates about free speech and whether like technical oligopolies have gotten way too much power, and can we reform it, and blah, 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 and all that stuff.
No, I respect that. I think I disagree a tiny little bit. I think we could hold both simultaneously, and that, even though I'm getting more and more concerned about what Brett's having to say, and I haven't really made up on my mind of it a whole lot, because I have an issue with people like myself who don't have no scientific background and really jumping to conclusions. So I'm keeping an open mind, but I'll say that more and more as time goes on, I'm getting more and more concerned about what Brett's saying and how he's clinging on to some of these ideas, but that I am just adamantly opposed to what YouTube's doing to him. And it's there's a point of the argument for, well, you can find another platform, but like some of these companies are getting so immense that there's a major antitrust issue going on. And a couple of the billionaires and some of these big companies, it's beginning to be what things were like 100 years ago with like Carnegie and Rockefeller, where it's just not an issue of, oh well, free enterprise, don't worry about it, find something else. It's a bigger problem there. But yeah, I've taken that from you already, before.
Actually,
that you're more worried about the science and just looking at that.
Yeah, absolutely. I mean, I think maybe I stated it a little too broadly. That, I mean, I am much more concerned about the science than this free speech discussion.
Right.
I'm not saying like nobody should have, or that it shouldn't be had concurrently. Absolutely. Like if you want to have discussion on free speech, by all means. It's just I'm not like now interested in it all that much. And at the same time, I definitely agree that YouTube shouldn't be taking down those videos, as bad as they might be. But yeah, like censorship now is not a good time. Like, or I don't know if any time is a good time for it. Even though, like legally they might be within their right to do so. I'm just as you. I'm not comfortable with having YouTube delete videos over their policy. And yeah, I think we have to probably have a discussion at some point where does YouTube, because it did morph into essentially like a platform for expression rather than just a business for people posting their cat videos.
Yeah. Oh, I miss just the days of cat
crawling and
people falling off their bikes and stuff like that.
Those were the days, man.
Those were the days. Okay. Then one thing you guys mentioned, and this I'm really not too sure about this, and maybe I just haven't paid enough attention, but you mentioned earlier on in the article about I should find the exact line that you guys had to clarify this a bit more. So bear with me, everybody, and my lack of preparation. But it was, let's see. Find it, Josh.
What was it? Maybe I can help out.
Yeah, you could probably remember off the top of your head. Something about many of his followers campaigning behind, I think something, a component of his message.
It's a bit too broad.
Yeah, it was a bit too broad. I
mean, there's this paragraph. The Weinstein has become.
Yeah, sorry about that, everybody. I'm not the sharpest knife in the drawer. So just after the YouTube terms of service comment, you note, many of his followers finding that evidence of conspiracy. Now, I think within what some of what Brett and Heather have been saying, there's sort of some touching in on that sort of concept, and I think that a lot of people who are really critical of Brett and Heather over the long term have really jumped on this trend, and I think a lot of people have really overreached this and have been sliming Brett and Heather for a long time as just being conspiracy theorists, and this would have you pertained, of course, to the issue where you and Brett had some collaborate, or maybe not collaboration, but discussions. Of course, the lab
agreement,
agreement discussion. Yeah, the lab on the lab leak hypothesis, and then there's just sort of the idea that goes along with that so many people are just hang on to everything that he has to say. Now, is there much evidence that there are that many people who listen to Brett's program that are finding all this like evidence of conspiracy, or is it just like a bad sample off of Twitter? I'm just unsure of how much of his audience is like leaning on some sort of like hardline conspiracy. Because I know a lot of people who listen to the program, and I've listened to, not before the pandemic every episode, but I think I've listened to almost every episode on his pandemic coverage, and everybody I've talked to have like enjoyed a lot of what he had to say, and are also kind of concerned about the stuff that he's been saying lately. So I'm just not too sure if how many of his followers and what that specifically entails are actually seeing like some sort of active conspiracy going on.
Right. Well, I think it's tough to like put an estimate on the percentages, but just going off of comments under his videos where there's a lot of positive comments, I think there's a substantial number of people who think that, or who agree with Brett, that there is this, pharma conspiracy, big pharma conspiracy, or suppression of ivermectin and blah, blah, blah. So, I think how many or what percentage, I mean, I definitely think that most people, even those people who watch Brett and Heather, most of them are still reasonable people who are able to discern misinformation or complete and utter bullshit like conspiracy theories about like big pharma from reasonable conspiracy theories like the lab leak. I'm kidding. Although, I mean, the lab leak is, I guess, by definition a conspiracy theory, but it doesn't make it wrong.
Right.
Because there's been a conspiracy potentially to suppress what happened doesn't make it wrong. And obviously everything is still unproven in terms of the lab leak origin. It's not a theory, it's a hypothesis, and both like the natural hypothesis is unproven, lab leak hypothesis is unproven. And it's funny though that I think now that the lab leak hypothesis is in fashion, a lot of the people like give Brett a lot of credit for being right. And of course, we don't know yet, but he did, promote the lab leak hypothesis early on. And just because it's in fashion now, it doesn't make Brett more qualified on any other topics, especially medical topics.
Is the credit for him? Is the credit for him being right, or like the same reason that you're getting credit now, or Alina Chan's getting credit now, is that you guys were right in that this wasn't a crazy thing that should be talked about, and that the people who were suppressing the conversation about this important topic were
I don't know.
In certain cases the crazy ones, or in a lot of cases just malicious ones.
I don't know like what exactly he's getting credited for being right about, or whether it's definitely that suppressing it was not the right thing to do. It shouldn't be suppressed, and it's not a crazy conspiracy theory, it's a valid hypothesis. In terms of that he was right, but that doesn't translate towards being right in any other domain. And as I mentioned, like on a different podcast, like Trump was also, I guess, right in that it should be suppressed, and a lot of people would not trust Mr. Trump's opinion on pretty much anything. So I'm not sure why, whatever Brett's position was on the lab leak hypothesis somehow qualifies him to give out medical advice on vaccines or ivermectin. So this was the only point that I wanted to make on this.
Okay, now I got you. And you mentioned the Tess Lowry, what she's written, and you're not a fan.
No.
I'm wondering. You write that to quote, she has a phenomenally insane paper. I'm just wondering in what regard, and maybe again this is a problem that you had in the editorial process, because I watched one video with Tess Lowry, and she seemed to lack scruples, I would say, for my assessment. Again, like this, I can only dive in so far, not being a scientist, but I wasn't sure what she was trying to get at with a lot of points. But all the same, can you elaborate on what's wrong with the paper?
I don't think I need to elaborate any further than the two quotes that we have in this paragraph. The Tess Lowry paper calls COVID-19 vaccines unsafe for human use, and that same paper advises that preparation should now be made to scale up humanitarian efforts to assist those harmed by the COVID-19 vaccines. Like, if that is not insane, I don't know what sane then is for you, because that is, like, I mean, insane in a hyperbolic sense, but this is like completely ridiculous claims. And yeah, if you actually read, we'll link to the paper that she published, which is entitled Urgent Preliminary Report of Yellow Card Data. Yellow card is like VAERS in the UK.
Right.
So, I mean, it's just like, if you read it, you realize just how, unsubstantiated or overreaching and just plain. I don't have, like, I'm trying to come up with non-insulting adjectives and failings. So let's just leave it at that.
I gotcha. You note, and this is one thing I'm not too sure about either, that and I wasn't sure what you're referring to. You wrote that the impression that listeners might get from the podcast is children have no risk from the disease. Are you referring to a specific episode, or like the podcast in general?
The children can die from COVID is a point worth stressing, given the emphasis that Weinstein and other vaccine skeptics have placed on the vaccine's risks to children. The impression listeners might get from Weinstein's podcast is that children are at no risk from this disease. Well, I mean, the podcast with, like, the Save the World podcast, they have on multiple occasions talking about that. Vaccinating children. Like, why would we want to vaccinate children who have virtually no risk of dying from COVID? Or I wouldn't say that this is like exactly declaring like zero risk, although they might be. I have to revisit the transcripts that we use, but obviously the implication is that we shouldn't vaccinate children because their risks from vaccines outweigh the risks children might have from COVID. And it's just, again, very silly thing, because the risks from vaccines to children are like so small, like I would say even close to zero, then or at least like to young people. I don't know if we have reports, but again, I make this point often, that children are actually the least dangerous population for vaccines, like, because I mean, children are vaccinated all the time, and children between ages of like 5 and 12, or between even after like 12 and 18, but even between 5 and 12, they're like some of the healthiest humans ever. Like, this age, you can do no wrong. I mean, they can eat whatever the hell they want. They break whatever the hell they want. They heal very quickly. Like, even brain trauma at that age is very quickly, they recover. And I mean, there's evolutionary reasons for that. But they get jabs all the time, and they don't suffer any ill effects, and they get sick all the time, and like the viral diseases they have in childhood they very easily get over it. Like, you get measles when you're 40, you're gonna be screwed. You get measles when you're a kid, like, no problem. Basically, their risks of vaccinations are like the lowest. And being afraid that like children might suffer ill effects from vaccines is, I think, driven by not rational thinking, but irrational of, we have to be protective of all children, and this is just an instinct. But if you think rationally and examine the data of vaccine negative effects on different, age groups, children are the least affected. So actually, like, there's virtually no risk to children if you vaccinate them with COVID-19 vaccines, and there's benefit to both this very same children, especially with like new variants like Delta. We see that they affect more and more people in the younger groups, and more like younger and younger people are getting bad COVID from Delta. So there's definitely a protective element on the vaccines, but most importantly, it's a public health benefit, that you need to vaccinate as many people as possible to get herd immunity. And children and teenagers are the biggest spreaders of COVID. They're like both in terms of shedding the virus and interacting with more people. So it's been shown in research time and time again that this is the age category that spreads the COVID the most. So you actually need to, like, if you really want to stamp out COVID quickly, you need to vaccinate those categories. And I think the risk, like the individual risk to like any potential child or teenager to be vaccinated is very, very small. And the benefit to society to justify that risk overwhelmingly outweighs that risk. So we should absolutely do it. We should absolutely vaccinate children, and we shouldn't like spread fear mongering just out of our ignorance of what exactly can happen to children, because in past vaccinations, like children have had the least amount of negative effects. And in this case, of course, we'll have to run clinical trials first, and they have run clinical trials. They have shown in some age categories that it's safe, and we have to verify, of course, for all age categories in which the vaccine will be deployed. But so far, we have very good safety data for children. So I think, to me, this is a no-brainer that we do need to vaccinate children.
Okay, yeah, I just wanted to clarify that because I wasn't sure if you're referring to a specific podcast or the podcast in general. Because I'll say, perhaps that's the case. Like in the what is it, the Save the World podcast, that maybe somebody could get that impression. Then again, too, like people can get all sorts of impressions. But I'd say from that one in particular, like just
could be also
from way, yeah, possibly that too, yeah. But even just from weighing it, they might get a concept that you've outlined there. But as a whole, throughout the podcast itself, as a series or whatever you want to call it, for whatever flaw they may have in what they've been saying lately, both Brett and Heather have been very emphatic on the harms of COVID to absolutely everybody. And early on they were, but when there was like a big focus on just deaths versus not deaths, a disregard of possibilities of long COVID and all that, which just turned out to be a gravely severe issue. And and just looking at it that way, they were very adamant on nobody should get this. This is harmful to everybody. So, but yeah, within the confines of some of these more recent podcasts where they're weighing certain issues, but as a whole, like that is one point that they've been very accurate on, and very early on, and very adamant on, is that nobody should have this, and this is very harmful to everybody.
Yeah.
Then one question I have, I just don't, it's not that I don't have any pushback. I just don't really understand this. I was just wanting you to explain this to me. What is the significance of the half-life of ivermectin and the concern with that?
And the Deigin threshold, as Brett Weinstein had put it. So basically,
oh right, yeah, they did break that up. That they called they had a little riff on that one. Yeah, right. The Deigin threshold. Right. Anyway, yeah, I'm just wondering like what effect that is, and how that applies.
Sure, it's basically the logic of using a weekly dose of ivermectin for prophylactic purposes. Basically, we know that its half-life is so short that a weekly regimen would offer inadequate protection based on basically for antiviral activity to occur, the agent that has the activity, in this case ivermectin, needs to be present in the plasma, in the cells, to provide that activity. And basically, the initial idea why ivermectin might be effective against COVID came out from an in vitro study. Like they used cells, green monkey cells, in which they infected it with SARS-CoV-2, and like tested different agents, tested ivermectin, and saw that ivermectin inhibits the replication of the virus in those cells. And the concentration that was effective, unfortunately, it was much higher than actually is ever present in humans after getting dosed with ivermectin. But it still didn't stop people from then trying ivermectin in high doses, but obviously not as high as the ones that would translate to the same concentration as in cells, because it's just not allowed. Like under the current approval, that concentration is just not anybody. No doctor would prescribe it, because it just probably would be toxic, or at least it's just hasn't been proven safe and non-toxic. But so they use a lower concentration. But okay, it doesn't matter. Let them do whatever study they want. But just based on the pharmacokinetics and pharmacodynamics of ivermectin, we see that it would very quickly leave the body, or at least it would, the concentration would greatly diminish of ivermectin in the bloodstream or in plasma from the initial dose, so that if you really wanted to maintain any sort of high enough level of ivermectin to be protective on any sort of level close to what was observed in the green monkey cells or in cells in general, to be able to stop the virus from replicating. If you dose it just once a week, it's absolutely inadequate to have any kind of baseline ivermectin concentration in the blood or in the cells. And so, my question is, why does Brett think that a weekly dose is enough? Because, to me, 18-hour half-life is completely inadequate, because within 2 days you get I think a quarter of it left, and in another 2 days you're as low as 1%, and by the end of the week it's completely very close to zero. So, to me, if the dosing regimen, the frequency of dosing for a therapeutic agent that you need to be taking chronically is usually determined based on the half-life. The developers of drugs look at the half-life and okay, if we want this to persist at the certain enough level in the blood, you need to be taking this daily or twice daily, like antibiotics or antidepressants. You need to build up baseline concentration, and to do that, because of the drug's half-life, you need to be taking it this frequently. And if you don't, you're not going to get that baseline concentration. And in the case of antibiotic, it's not going to be as effective, or the antidepressant, same thing. It's just not going to get the right inhibitor reactivity. Same thing with antivirals. And if you're taking prophylactically an antiviral, you need to maintain you can't have peaks and valleys where you have 2 days of adequate level, and then 5 days of the week it's a fraction of the initial dose, because that fraction is just not going to be as effective as a prophylactic concentration. So if the half-life of ivermectin does not support its use as a prophylactic antiviral drug in a weekly dosing regimen. Now they come back to that and say, oh, but we see it working as a anti-worm drug, where they take it prophylactically once a week or once a month, and it still works. And why does it work back in those scenarios, and you think it wouldn't work here? Well, anti-worm drug is very different, because it's not building up a concentration in your body that is preventing a new virus coming in and so that there's a baseline concentration that will just kill it. Most likely a deworming agent either just kills the worms that are already inside, and once weekly, once monthly is enough. You kill the existing worms and all their larvae, their eggs, and just once is enough. Or if, like, prophylactically as well, if you already have those eggs in your system or those worms in your system, you take it once, you kill them all, and that's it. You don't need any more, and it can last you for months until you, I don't know, ingest new worms in yourself. Or again, is a prophylactic agent if you don't have worms yet or symptoms of worms yet, but you might have their larvae, their eggs, or whatever. Like, and if you take ivermectin, you just kill them and you don't have it anymore. But as a how it works in that scenario is very different. How it can work as an antiviral. So, like saying, look at those studies that they used the once monthly is absolutely inadequate to support its use as an antiviral based on, again, the study in cells that were dosed by these high concentrations. So this is, I'm to a person with, again, baseline understanding of drug development or pharmacology, he would get it. Like, he would get this comment like, why are you dosing weekly if your half-life is 18 hours? And the person like, yeah, it's a good point. Yeah, you probably need at least like a bi-weekly dosing to have a good enough steady state baseline. But maybe. But to Brett Weinstein, he's like, we don't know how it's working. It could be working like. Okay, he didn't say like a vaccine, but he's like, there's some agents that don't depend on the concentration in the blood, but are still effective, like vaccines. And I'm like, you didn't just compare vaccines, which just train the immune system and disappear, and
Right.
whatever is left in the immune system is actually doing the work, to a small molecule, which, it's a small molecule. It's easily degradable, digestible, and gets out of the body very quickly. And there's just no mechanism that, at least I can see, that it, has any sort of like long-term reservoir. Like, he's saying like something completely silly that, maybe it gets stored in the fat tissue, and then on challenge with a virus, it gets released from the fat tissue. Like, what? Like, how do you foresee, like, what is the mechanism in your body that will store ivermectin in your fat cells? And then if your lungs get infected with a virus, those fat cells will spew out ivermectin and neutralize the virus. Like, this is a completely mythical understanding of biology. And anyway, so that is that. So I guess, again, I took about 2 hours to answer a very simple question. So I think you dozed off in the middle there somewhere.
Yeah, had a nap and, had a shower and all that. No, I was just wondering because, again, this is really outside of my wheelhouse, and I was wondering the significance of all that. A couple more just from reading through. You mentioned that they have a misunderstanding with the VAERS system, and I for everybody who's unaware, explain what the VAERS system is. But unless I missed something, didn't seem to be too much of an elaboration on that. And again, like, you guys had a brevity issue that you had to be contending with. But the reason I bring this up is, right or wrong, that's one of the main things actually, that's the huge thing that Steve Kirsch is leaning on. But also, like, everybody else, Brett and Heather and Dr. Malone are also, there's a really large component of their argument is an array of issues with the VAERS system. And so just not just reading the data, but then how the data is accumulated in the first place. So what's their, so yeah, explain to everybody what VAERS is and yellow card and all that jazz. And then where are they going awry with all that?
Sure. Well, I mean, so VAERS is the American System for Vaccine Adverse Events Reporting System. So basically, it's whenever bad things happen after vaccination, health providers and vaccine manufacturers are obligated by law to report this into the centralized symptom reporting system so that it can be investigated. And basically, this is so that we catch those very rare but potentially serious events, which vaccines that get tested in 40,000 people, which are deemed safe, then when they get applied to 100 million people, like very rare events can go unnoticed. And so we have this reporting system, and it's country by country. Different countries have them, some countries don't, I guess. I don't know. Well, this is all part of pharmacovigilance, basically making sure we catch serious, very rare events. And again, this is by definition very rare events. So your vaccine is safe, like safer than, I don't know, your car, your alcohol.
Well, a lot of things. So many things are safer than your car. It's pretty dangerous.
No, but I mean, in general, like those bad things happen on like once per million, once per 100,000 people vaccinated. Very rare bad things, and some people die of like anaphylactic shock. And so, not just this vaccine, in general, this is bad, but on balance of what the vaccine provides in like number of lives saved, probably in the millions, like just in the US alone, if you consider like COVID mortality and how many people would have gotten COVID had vaccines not been there at all, it's probably millions of lives saved versus millions. It's probably like tens of millions. Because what, like 33? No, like 600,000 dead out of 33 million. Doesn't matter. I mean, yeah. I get into like these tangents. Why do I do that? Anyway, but
a person or two.
Right. So basically, so that's what the system is, so that these rare events get reported. But in addition to those health providers being obligated to report all these events, it's a self-reporting system so that anybody can report this adverse event from a vaccine, which they think, could be caused by a vaccine. They report it into the system so that the CDC or whoever investigates. Like, this system is not the compendium of vaccine-caused deaths. This is a compendium of what could have been caused by vaccines. Okay, it's weird that my grandma got a vaccine shot and died the next day, but let the experts investigate. Or it's usually not my grandma, it's my patient. I'm a doctor, I'm a health provider, I do like vaccines, and then I had some patients die or develop adverse reactions. I put it all in the VAERS system and let the vaccine manufacturers, in conjunction with health authorities, regulators, investigate. Is this caused by a vaccine or not? And then they do their thing. They analyze all the data available, probably the autopsy report and all that, and they come to the conclusion. Was this death caused by a vaccine? Was this adverse reaction caused by a vaccine? And if it is, it goes into a different category, and then they tabulate this periodically and say, oh shit, this vaccine is causing, I don't know, the horns start growing in 1.1% of people. We should probably take it off the market. Yeah, something like that. But usually, nothing bad happens. And, these rare adverse events remain rare enough to justify keeping the vaccine on the market. But sometimes even rare events don't justify keeping the vaccine on the market because there's a safer alternative without those rare events. Case in point, AstraZeneca vaccine was pulled after, these thrombosis, very rare cases. But, there's other vaccines that don't have it. So, why risk people's, not necessarily lives, even just health? It's not like not all of them are fatal, but it makes sense. If you got a safer alternative, let's just stick with it. And so this VAERS system has by now had, I think, close to 6,000 deaths in the U.S. reported as potentially caused by a vaccine. And again, in the beginning, most of these reports were reported by relatives of people who died after vaccinations. And the spike in those deaths was in like reports in I think February, and then in March it was like much lower. In April it was lower still, and in May there's just a very, very small number of new reports. And these are not proven deaths. I reiterate, these are potential deaths that take a long time to investigate. And, eventually they get to the bottom of it, the CDC. And at this point, I think CDC said that only like a handful of confirmed deaths have been linked to a vaccine. So, I mean, all of these reports have been blown out of proportion by people who didn't essentially understand what the hell VAERS is. And they just, oh my God, thousands of people are dying from these vaccines. But even if that was true, if like thousands of people were killed by vaccines, on comparison to COVID, which is really, you can't assess vaccine safety in isolation. You need to assess it in conjunction or against the risks of, what is the thing the vaccine is preventing you from contracting or dying from, like COVID. And so like millions of people, or 600,000 people in the US have died from COVID out of like 33 million cases, or let's take 100 million cases for all the untested asymptomatic cases. And so you got like 600,000 out of 100 million. And at the same time, there's been like 150 million vaccinated in the States. And out of those, like 6,000 deaths, 100 times less, right? 100 times less for higher number of people vaccinated. Like, so vaccines are at least 100 times safer than COVID. And you're still like concerned. And most likely vaccines are, 1,000 or 10,000 times safer, because only like, 600 or maybe 100 deaths are really caused by vaccines, rather than, people thinking that they might be. And then ultimately they'll be proven not to have been caused by vaccines. So this is all like such, again, like evidence of people not understanding just basic data analysis or just basic math, trying to compare like apples and apples, or people comparing apples and oranges, and just, deaths in isolation, or deaths even like in absolute numbers of death, which seem low, like, oh my God, 6,000 people. But if you actually compare that rate for, actually, I think it's like 150 million vaccinated in the States, if not more, which is minuscule in comparison to COVID death rate. It's minuscule, and all other risks are small. So vaccines are like very safe comparatively, compared to COVID. And like, again, this is what people seem to misunderstand, that we need to compare the vaccine safety not to vacuum, but to COVID, like their chances of contracting it. And in general, also like population wise, again, like some people make the case, oh, but I'm so young and healthy. Why the hell do I need to risk my health for your vaccine? Or why do I need to risk the health of my children for vaccine? Well, because we're trying to stamp out COVID for everybody, so that, your grandma, your parents don't contract it because you're an idiot, and don't help us eradicate it, and they don't die from it. For that we need herd immunity. For that we need to vaccinate as many people as possible to prevent transmissions between new infections and stamp out COVID for good. And the only way we can achieve it, especially with the Delta variant that is just so much more transmissible, is if we vaccinate a high enough proportion of people. And not just any people, but people who are most likely to transmit it, most likely to be asymptomatic, and those are children and teenagers. Those are the two biggest transmitters, and the people who notice it the least, and they're most likely to give it to grandma. So that's why I think it should be very clear to people why we need to vaccinate, not for just like selfish reasons, but for public good reasons. And sometimes just people, like some countries are less susceptible to understanding this than others, hopefully, or thankfully. Canada is like one of the leaders of understanding it and doing a good job about like vaccinating high enough number of people and wide enough number of groups that we're going to get there. Like Canada's going to be the shining beacon of the world, with eradicating COVID and protecting pretty much everybody, ultimately.
Hope so. And like the point of that vaccines are not just an individual issue, but a collective issue.
Mm-hmm.
That really ties into everything that's gone on the past year and a half. Is there hasn't been enough people trying to gauge every sort of measure, every sort of action, every sort of intervention, It's too much of it's been looked at in one dimension, and then there's all the dimensions, and like the sort of your proximal collective unit or the broader collective unit and the individual unit. You should be concerned about yourself, and it's okay to be concerned about yourself and all that, but there's been too much of a focus on that. Then trying to look at all three, engage all three, or even bad messaging in protect the community and wear a mask, get vaccinated, et cetera, fill in the blank. And that might even turn people away, because you should let people know that that there's benefit to oneself for all of this. And so that's been an issue throughout the whole pandemic, is looking at one factor of who's being protected instead of looking at them all and engaging them all accordingly. But on like you mentioned, the confusion with the VAERS system, and I've seen some of that online, is that people will look at the VAERS system and then think that it's sort of like an official tally, where it's not the reporting system that it is. But is that the argument that Brett's been making? And I've seen Steve Kirsch take it a step further, is that there's the deaths in the VAERS system, and then I can't remember, but it's something like it's times 10 that or something like that, or maybe I shouldn't have said that, but wigher than what the VAERS system is letting out. But is that the argument sorry, that Brett's been making? Is I just can't recall, has he been going off of the VAERS data in that regard and saying that these are the figures?
I think he's been pretty elusive or evasive about actually stating that precisely, but he just repeats or refers to other people who have been stating this. Steve Kirsch being one of them, or other people like Telomere and with her yellow card system. And basically, he doesn't go on record on repeating their exact wording, but by referring and endorsing them, or retweeting Telomere's paper and putting emphasis on her vaccines are the worst thing that ever happened to humanity. I'm exaggerating, but for point of emphasis. But basically, he endorses this viewpoint, and he never challenged Steve Kirsch on his Save the World podcast, where Steve Kirsch was saying all these nonsense about, oh man, we're seeing just 1% of the deaths being reported, because there was this study before that said only 1% of adverse events get reported, and so now they had 5,000 deaths in the system. Well, I'm not saying it's 500,000 in actuality, but I'm sure the number is way higher. Of course, it's stupid, because the 1% referred to mild adverse events, fever after a vaccine or headache, which most people don't report because they just don't bother. Why you want to call your doctor about a headache, which is an expected side effect of a vaccine shot? So you just don't report it, obviously. And you can't extrapolate that 1% to the deaths number, which pretty much all deaths that are ever potentially connected to a vaccine get reported, just because by virtue of, if somebody dies within, I don't know, a certain 2 weeks of vaccination, the death, the coroner, that's an obvious question they're going to ask, and it's probably going to be on their medical history that they've been vaccinated. And so it's just a pretty much automatic report to VAERS that, okay, you guys should look into this. That this person died and they've been vaccinated, so it automatically gets flagged and sent to the VAERS system for further investigation. And of course, the autopsy and all the other reports will show whether there is a connection or there isn't. So, and Steve Kirsch has just been fear mongering like crazy on both on the podcast, on Twitter, on his huge. Never-ending blog post that he just keeps adding to. Is I just discovered that it's actually 28,000 deaths that have been kind of unaccounted for, and I think they're due to vaccines. Oh my god, dude. Anyways, so it's that kind of misinformation that Brett was, if not like outright repeating, then endorsing, and definitely not pushing back on for his guests. And that's why, these are the messages being disseminated through Brett Weinstein that create the vaccine hesitancy and the impression in people that vaccines are just killing people in droves, and we exaggerating, like killing people, dropping like flies. This is hyperbole in a public or not public, popular opinion piece. So obviously they're not flies, they're not dropping like flies. They don't have wings. It's
but
yeah,
it's like Brett. It's like and maybe I'm wrong. Maybe he has pointed to this a lot, and maybe somebody will say, Josh, you moron, he has been saying that. I just can't recall. But yeah, even at like, let's just take the one point that you had. I think that's something to emphasize upon is that he's talked about this on his show, hasn't pushed back too much or questioned it too much, and references Tess Lowry a lot and all that. And I think that there is a lot of times where he could be questioning this a lot, or even with the guests in general, with Gertrude Bosch and Steve Kirsch, where he has them on the show, and it's okay to have somebody on, and I'm totally okay with any. I absolutely can't stand when somebody brings up like the concept of platforming and all of that. It's all absolute gibberish. But at the same time, like when Brett has on Steve Kirsch or Geert Vanden Bosch, like there's no pushback. I can really think against those two, and maybe I'm wrong. Maybe
no. I don't think there has been ever any pushback, at least that I've seen in those podcasts. What's platforming? I mean, I've heard it before, but I never.
Oh, it's just the concept of you talk to somebody, you have them on their show, and if this is a bad person or a problematic person that you're bringing on the show, and then you're doing only by default like a negative action by having a discussion with this person, regardless of the context of the conversation. If you're pushing back against them, asking them tough questions, it's I think a lot of it's rooted from more not scientific conversations, but more social conversations. Somebody's very ideological, and there's somebody who's very much anathema to their ideological positions, and then that person got platformed by so and so. I've heard that in a lot of the context of COVID. So like in the general sense, I'm perfectly okay with Brett, having a lot of these controversial people, and it's kind of interesting. But even though like he's not come out and said like some of these positions, you're right in pointing out that like he has some degree of endorsement by referencing them or having them on, and not giving any sort of pushback or anything like that. And I don't know why. And maybe it is
because
maybe
he agrees with them. He definitely agrees with them, and it definitely comes across on the podcast that he completely agrees with them. When you see the conversation and the non-verbal cues that he has, he nods, he absolutely agrees with their messaging. Mm-hmm. So, and when he does, or he corrects them sometimes with some minor things, you can obviously see when he does disagree. But most of their messaging, he endorses, he agrees, and he propagates. So I don't think he ever brought anybody on his podcast with a dissenting opinion on any of the topics that I've followed on COVID, Ivermectin, lab leak. I don't think he never. I think he's just so comfortable in his echo chamber that he's just afraid, or I don't know.
Well, on the vaccines and stuff, like in Ivermectin, I bet he could get somebody there's actually people in his who have been in his circles for a while who take the opposite position, who are very cordial. I bet he could have Nicholas Christakis from Yale, who's very pro-vaccine on. And
I mean, I was very cordial. No, I suggested
No,
on several
I'm not
occasions
saying. Yeah, I wasn't
that I
referencing
want
you, but I'm
to
saying
debate.
like, yeah, like I'm saying that there's a whole bunch of people, or yeah, like I guess he could even had like, because you guys were corresponding before this article, obviously on vaccines and stuff, and Brett referenced that, so he could have had you on, and you guys could have like had
No,
a
I actually
back and
asked to
forth.
go on.
Yeah.
I mean, I suggested, I asked to have a podcast debating these things. I suggested it on several occasions. I suggested to have Luigi Warren on, who is the the actual mRNA vaccine inventor. Well, okay, mRNA technology that Moderna uses. He's on the patent. I mean, he's one of the inventors, or probably the inventor of that technology that Moderna uses. And he's also very skeptical of mRNA vaccines, however ironically that might sound. But so we had some sort of debate with Luigi, and then he also wanted to go on Brett's podcast to pretty much defend Brett's position. And I was willing to debate him and Brett. And, that like I several instances, I emailed Brett and suggested it. And he said, sounds like an interesting idea, but never actually invited, never organized that kind of debate. So yeah, I think he's just only promotes his opinions, his views, and doesn't want to be challenged on them, which is again a huge red flag. That, well, I don't know, just a huge red flag for me. So
that's interesting. Like there hasn't been anything really out there talking about that, so that's something to mull over. But like what I was going to push back on, like just a tiny bit, was like on the lab leak thing. Like God, there is no way that he was going to get anybody like who. There's no way somebody at a year ago or even 7 months ago who was anti-lab leak who would talk to him or on his show. I doubt would happen.
Why not? I'm sure
you don't think
Angie.
so?
I'm sure Angie, our dearest friend Angela Rasmussen, who like is, I don't think passed up any publicity opportunity ever, would pass up an invitation to Brett Weinstein's podcast.
Okay,
I'm sure enough. She would have, or even Christian Anderson is pretty cool debating that, and he's been on a number of podcasts. So I'm sure he possibly could have agreed. Again, like it's not my place to tell Brett who he should invite or not, but like if he wanted to have a debate on it, I think he could have reached out to those people. Anyway, but I mean, in this case, I mean, actually, I have proposed, I have suggested, I have asked, and he chose not to. So is he afraid of debating? Is he like not sure of his position, or is he just I don't know what his motivation is for not? I mean, he says so much that he's after the truth, and he's all about like dialectics, trying to like find out the truth. He's not about debating and winning. He's about finding out the truth. Well, you sure can't find the truth if you only bring on people who agree with you. So,
and what I'm worried about is this. To circle back to what I said at the very beginning of our talk here, is that I worry that he would bring up the point of bad faith again. Is like this has been this was my initial concern with criticism.
It's just a cop out
of Brett. Well, I'm not sure if it's a cop out. It might be, but I think he might be at the point where he's seeing this all the time. Do you know what I mean? Like he's.
It could be a subconscious. I mean, he could still believe in it, but
like he's interpreting so many things as bad faith when they're not, and so there is even if there's a really strong disagreement, like it's not necessarily bad faith, it's just a strong disagreement. So I'm worried that might be what he's interpreting. And I had a conversation with a friend yesterday. Again, I'm having these talks like with what's going on with Brett. And like maybe it has something to do with like Evergreen, not just Evergreen, but like everything that happened with him following that, because he did get a massive amount of bad faith thrown at him, and so much that was thrown at him was just completely ridiculous. At Evergreen and the backlash to him talking about that situation and the stance that he took, in which I agree with him, 1,000,000,000% on where he stood on that whole affair. He was completely in the right. And like the amount of sliming and maligning he got in, I don't know, what, a year or two, or with Evergreen, and after that there was so much bad faith that it's like almost like hit something in his mind where he's on guard all the time and like finding bad faith in so many things, instead of just being like, I don't want to have this tough discussion with somebody as a cop out. Maybe that's the case, but I'm one, like when I had this conversation yesterday with a friend, like maybe that's what he's been doing, because because it started off with the last 3 years or so, just seeing him like bad faith, where it almost has become a mantra. And I'm wondering if there's something more to that, and it ties back to Evergreen.
Maybe, I don't know. Yeah, or just in the past it worked with Evergreen issues that you can always kind of dismiss criticism as, it's bad faith, because it's all about, it's like not objective scientific debate. It's more of a subjective ethical issues or social issues. And yeah, you were right that he was, I think, a lot of criticisms of him were, I guess, bad faith, in terms of like they weren't objective criticisms. But here, and then he's so used to dismissing criticism as like bad faith, and if someone's like maybe not very nice to him, or a little bit of challenging him in a vocal manner, like Claire and I have done, maybe to him, like automatically that signals all that bad faith, and he just goes into that default dismissive mode of dismissing something because of bad faith, just because that phrase maybe is kind of meaningless now, and he doesn't even like understand what it means.
Yeah, I think there could be an attribute of that. Well, I think we've run this topic through its due course, and
going
maybe
for a record. 3 hours plus. Yeah.
But is there anything else that you'd like to say about this topic as you've gotten involved with it, and what you think might be happening with Brett and Heather going forward? Like not the communication between the two. I would put a few bucks on that they're just going to try to ignore you as much as possible. But like, what do you see going on with their level of discourse on these topics? And do you have any other thoughts or comments on what their reaction was to your pushback on their claims?
No, I have no idea what the reaction was. I think I already see them kind of backtrack a little bit on some of their most kind of outlandish claims. And I think just they're going to backtrack further and try to like pretend that, we were never against vaccines. We were always like, just, we should have the option of using ivermectin. Everybody should have the option. And like, we were talking more about the countries that don't have vaccines. And they're just going to like try to soften that stance. And eventually, because they're going to be proven wrong. And eventually ivermectin is just going to fall off the radar, like hydroxychloroquine before it and so many other things have. And we're just going to forget about this debate ever happened. Vaccines will hopefully eventually drive COVID out, and hopefully without booster shots, although there's like really nothing wrong about booster shots as long as they're properly tested, as the previous generation of vaccine has. But maybe we'll be able to like get away with surviving and stopping COVID and eradicating it, at least in the countries with the high vaccination rates, that provide kind of the example for other countries to follow. And eventually enough vaccines will be produced for the whole world and distributed pretty much for free to the people, that ultimately will just completely eradicate COVID. And this issue will just be like an academic issue. And there are like 5 clinical trials, like properly done, registered, randomized, placebo-controlled, double-blind clinical trials of ivermectin, both prophylactic and treatment, that hopefully will see results, and they'll be more or less conclusive. And I'm pretty sure they're going to demonstrate that, ivermectin is all not that effective, and definitely just not as effective as vaccines, as prophylaxis, and is just going to, get off the radar, and we'll live happily ever after. And Brett and Heather, they'll just find some other topic to monetize their YouTube channel on, and I don't know if they'll ever eat their hats on ivermectin being complete and utter ineffective medication, but maybe they will, or maybe they'll just ignore it and pretend that well, that's kind of what we meant, that we said that it should be used as an additional measure. Anyway, it'll be fun to see what happens. That's for sure.
All right, well, let's leave it there. You can find Yuri on Twitter.
Thanks for listening to this episode. The music you hear on this show is from the Jeff Lapp Trio out of Montreal. Find them at jefflapp.com. Shout out to Tara for doing the graphics for COVID On Air. A huge thanks to my editor Jeff at Bean Co. Studios in Regina, Saskatchewan. Please visit endcoronavirus.org for more information on ECV. Click on Join Us. Through that, you can volunteer with ECV, and you can subscribe to our newsletter, which is full of great information shot straight to your inbox from our delightful newsletter editor, Tracy. Also, please check out the blog at ECV, and hats off to Scott, our impeccable blog editor. You can find ECV on Facebook and Instagram and on Twitter at endcovid19. You can find me on Twitter at Mr. Farden. It's at MRFARDEN. Until next time.